not help. You need this to be research on these things. And if you have been part of most of our meetings, we are very particular about who attends our meeting because we have one enemy in the world which has to do with the farm industry. It's the tobacco, alcohol, and the sweet beverages industry. So we want to know if none of them is our meeting. We want to have a brief introduction of who and who is very important. It is also to familiarize and know who is here. For the industry, we know how to handle it. We are not going to fight. We are always particular. Listen, can you help me with money? So just the name and what you want from me. Yes. We can see your voice. Hello, good morning. My name is Daniel Achenapi from the National Center for Coordination of Early Warnings and Response Mechanisms. But I'm even please.
Good morning. I'm doing the environmental protection authority.
My name is Abik Karnis, the Mecca in the
My name is Michael from Ghana. Good morning. My name is Sekou.
Good morning. Good morning. I'm Prince Ahmad, Minister of Health. I work with the Ghana Metropolitan Evidence. My name is Good morning. My name is Mr. Francis. Person who with disabilities. Secretary of South through Association for the Ghana. So we are not to work this. Somewhere.
My name is Dominic Ashi, Minister of Sports and Recreation.
Hello, I'm Dora Edikati. I'm from the National Center. My name is Isha Bono. I work with the Ministry of Local Government, Chieftaincy and Legal Affairs, specifically the Environmental Health and Sanitation Directorate.
Good morning. My name is Michael. I'm from Ebola.
Hi, good morning. My name is Derek Wayne Wasati from the Ministry of Youth Development and Empowerment.
My name is Professor.
My name is
Abdul.
Good morning. My name is Lydia from Private Health Facility Association of Ghana, FAO spokeswoman.
Hi, good morning, everyone. My name is Monica from Delta Airlines.
Good morning. My name is Ali Abdul of the platform NCDs of the NCDs.
All right, thank you very much. Yourself, can you tell us your name?
Hello, good morning. My name is Francis Amizu. I'm a pastor.
Thank you very much. I am Solomon Foley. I will be our MC this morning. All right, so this event,
Good morning. My name is
thank you. Welcome, all of you. There has to be a proper welcome and remarks, and that's where we have gotten to. It's a collaborative event between the Ministry of Health and NCD Alliance Ghana. We want to have some brief remarks or opening from reps of these two organizations. First, let me introduce the rep from the Ministry of Health, a man I have come to love so much, very humble, and anytime we share invitation, he has never disappointed us. That's Dr. Hafiz. He's a public, oh, okay. Oh, I thought you know it better. Clap for Dr. Hafiz. Thank you very much, Dr. Hafiz, for coming. He's a public health specialist with over 23 years in public services. He's the chairman of the Intra-Country Coordinating Committee for Neglected Tropical Diseases in Ghana. And under his leadership, Ghana eliminated human African trypanosomiasis in 2024. If you're not a doctor, you'll understand why I'm struggling. He also chairs several technical working groups related to neglected tropical diseases, communicable and non-communicable diseases. Before becoming the director of the technical coordination, he served as the chief program officer for the ministry's external health operation. He has represented the ministry on several joint commissions for cooperation to present the MOH position to partnership. Before that, he has served as the national coordinator for the Lavicidin project for malaria and other vector-borne diseases control. He has served on the National Vaccine Institute Board as well as the Nurses and Midwives College. He is currently a board member of the Pharmacy Council as well as the Kumasi Center for Collaborative Research of the KINAS. He has been part of several high-profile delegations, locally and internationally, and is the current director for technical coordination of the Ministry of Health. He speaks several international languages, including English, Spanish, Portuguese, French, Arabic, in addition to some local languages. I'll be interested, Dr. Hafiz, when you take over, let me know if you speak Ewe as well, or Adam. Dr. Hafiz Adam Taha. Let's welcome him to share an opening remarks with us this morning. Welcome, thank you.
Thank you very much, Mr. MC, for those humbling words. First of all, before I deliver my speech, I want to apologize for my late arrival. Unfortunately, when I was just on my way here, I was called to sit in a meeting with the Cuban ambassador. And so, as I was trying to conclude, he was also trying to extend. But eventually, I had to get up to signal that it was time for me to be here. So, on these nice notes, chief executive and heads of institutions, my good brother, the dean of School of Public Health, University of Ghana, private sector leaders, including our telecommunication partners, distinguished representatives of sister ministries, development partners, NGOs, CSOs, the media, ladies and gentlemen, buenos dias. Oh, you also say buenos dias.
Yes.
That's Spanish good morning. I remember one of my classmates visited Kumasi and stayed for the vacation. So when he came back, he was so boastful that, oh, now he can speak Chipa. So somebody said, so if they say Aiko, how do you respond? They said, oh, if they say Aiko, you also say Ko. But in this case, I'm greeting you in a proper manner. So I'm delighted to address you this morning at this important convening focused on a matter of growing national concern. The rising burden of non-communicable diseases in Ghana. I wish to commend all participant institutions for demonstrating and your making your presence felt this morning. It showed a shared commitment to advancing the health and well-being of our people. Distinguished participants, according to the World Health Organization, NCDs primarily cardiovascular diseases, cancers, diabetes, and chronic respiratory diseases are the leading cause of death worldwide, accounting for about 70% of all the deaths. Approximately 41 to 43%, 43 million deaths annually. Notably, over 75% of NCDs related deaths and 86% of premature death under the age of 70. They occur particularly in the low and middle income countries. Coming back home, Ghana, we are currently experiencing a triple transition, and that is demographic, socio-economic, and epidemiological situation. While we continue to make progress in reducing infectious diseases and improving maternal and child death outcomes, NCDs are increasingly affecting our population. It is therefore striking to note that current data indicate that NCDs account for over 40% of all cause of mortalities in Ghana. This is frightening. Beyond their impact on health, NCDs undermine national productivity, deepen household vulnerability, and pose a serious threat to sustainable development. They are drivers deeply embedded in how we plan our cities, design our transport systems, educate our children, yes, yes, but I'll leave it. So. Yes, my attention was drawn that I'm reading the keynote address. I say, yes, I'm aware. I'm doing that intentionally because I cannot sit through to the end of the. There are three things I'm to represent: the chief director and the minister. So if I don't do it and I leave, then you lose the keynote address. Half of the welcome is easily said, "Oh, welcome." That's all. So let me read it, and I welcome you. There was a situation where I was asked to go and represent the minister at the Ghana Health Service Directors meeting. By the time I got the midday, they had started, but I was opening it. So I told them that it was illegal, what they had done before my arrival. So anything after the opening was now duly legal. So distinguished and ladies, let's continue with the keynote address. So as I said, beyond their impact on health, NCDs undermine national productivities. They deepen the vulnerability of households, and they also pose serious threat to sustainable development. Their drivers are deeply embedded in how we plan our cities, design our transport systems, educate our children, and regulate industries, promote lifestyles, and leverage technology. The realities bring us directly to the central message of today's theme: creating commitment and eliciting collaboration. And so I'm so surprised, but in another way, happy when I heard somebody mentioned that it's from, did I hear GBC? GBC. Uh-huh. So I'm so happy that you are here. Often what we do is to call people within the health space who already know it all. And the tendency is that we leave you out, and in the end, we don't get the full impact that we desire. Distinguished participants, the evidence is clear that the determinants of NCDs lie largely outside the health sector. Unhealthy diet, physical inactivity, harmful use of alcohol and tobacco, environmental pollution, and psychosocial stress are shaped by policies and practices across multisectoral areas. This is why intersectoral collaboration must be the cornerstone of Ghana's response to NCDs. And that's why I want to commend the Alliance for the Human's Job, making sure that they push us to hold this national forum. Laurent and the team, commendation. What is required is a whole of government and whole of society approach, one that places health at the center of development, planning, and decision making. The health in all policies approach challenges us across all sectors to consistently ask this question: how does this policy affect population health? And how can it contribute to preventing NCDs rather than exacerbating the situation? So Ghana's commitment to intersectoral action aligns strongly with global framework that emphasizes collaboration as essential to NCD prevention and its control. And I'll mention a few of them. One, it includes the WHO Global Action Plan for the prevention and control of NCDs, which call for whole of government and whole of society action, which we are doing now. The 2030 Agenda for Sustainable Development, particularly Sustainable Development Goal 3, while recognizing the strong links between health and goals related to education, sustainable cities, climate action, and partnership. The other thing has to do with the political declaration of the United Nations High-Level Meeting on NCDs, which urged all countries to strengthen multisectoral coordination, partners, and accountability mechanisms. Together, these frameworks reinforce the understanding that NCDs are not merely health sector problems, but shared development challenges. Distinguished ladies and gentlemen, at the national level, Ghana has taken deliberate steps to institutionalize intersectoral collaboration for health. The National Health Policy 2020 provides a clear policy shift towards a whole government and whole of society approach. It recognizes the social, economic, and environmental determinants of health and calls for coordinated planning and budgeting and implementation across sectors at all levels of government. Similarly, Ghana's roadmap for attaining universal health coverage 2020 to 2030 positions the UHC not only as access to health services, but also as a prevention, health promotion, and population-wide reduction, particularly in relation to NCDs. Distinguished ladies and gentlemen, the roadmap emphasizes on prevention and promotive services, community engagement, innovative and partnership with non-state actors as essential enablers of UHC. In addition, the national policy on non-communicable diseases 2022 emphasizes early education, improved treatment, and management, strengthening partnership for resource mobilization and collective multi-sectoral approach to tackling the burden of NCDs. Together, this policy framework provides a strong and coherent mandate for our collective action. To further demonstrate our commitment, the Ministry of Health has established a dedicated unit for intersectoral collaboration, underscoring the importance we attach to this. Is he here so that I could introduce him? Prince, where is he? He's gone now. It would have been good for them to know who has been assigned to attend to intercorporeal sectoral action. So Dr. Dodo, please, so if you are passing by and you have interest in the area of NCD, please, you see Dr. Dodo at the TCD Directorate, particularly the External Health Cooperation Sector or Division. So distinguished stakeholders, each sector represented here today has a unique and indispensable role to play. Which are the roles? Sister ministries can integrate health considerations into policies on urban development, transport, education, sanitation, trade, and energy. The private sector, including telecommunication companies, can drive innovation through digital health platforms, health messaging data, and workplace wellness initiatives. The NGOs and CSOs, you play a vital role in community engagement, advocacy, accountability, and reaching vulnerable population. Development partners, you will continue to support us through financing, technical assistance, knowledge exchange, and innovation. When these efforts are aligned and mutually reinforced, the impact on NCD prevention and control will be truly transformative. Ladies and gentlemen, responding effectively to the rising burden of NCDs requires more than goodwill. It's not to come here and be reading goodwill to us, goodwill messages to us. It demands deliberate commitment, institutional collaboration, and shared accountability. It calls on us to break silos, harmonize our policies, and work together toward a common goal, improving the health and well-being of all people living in Ghana. Let this meeting serve as a platform to strengthen partnerships, catalyze actions, and reaffirm our collective responsibilities to represent the future of our generation. In conclusion, ladies and gentlemen, permit me to acknowledge the invaluable support of the Ghana NCD Alliance and its partners for working closely with the Ministry of Health on this critical agenda. I wish to reaffirm government's commitment to providing leadership, coordination, and an enabling policy environment for intersectoral action on NCDs. Guided by our national policies and aligned with global framework, we can collectively reverse the rising tide of NCDs and secure a healthier and more productive Ghana. On this note, I want to thank you for your attention and look forward for a fruitful deliberation from today's sitting. May I thank you once again for your attention and pray that may the good Lord guide our discussions and guide our thoughts and minds. Thank you very much for your attention. So, having given you the keynote address, I now want to formally welcome you and to say that take this meeting as seriously as possible. We can't underscore the importance of the rising burden of NCDs. and NASA said, we realized that we must put all hands on deck, including all of you coming from different sectors and different ministries, because we are the first as Minister of Health to know that we can't do it alone. Yesterday, I was once again privileged to represent the ministry at a workshop, 5-year plan for emergency response centers, nationally and regionally. So when I took the list and scanned through, I asked the organizers that I haven't seen Minister of Finance in that list. And they were surprised. What has Minister of Finance got to do with emergency and all those things? So I said, look, most of the things that we are doing, particularly that program, contain in it, seriously, is financial sustainability to be able to progress. So if the person who is going to give you the funds does not understand what you are doing, does not understand the value, the importance of what you are doing, it will be treated as a secondary matter when it comes to funding. And so they need to urgently include the representative of the Ministry of Finance. And I shared an experience with them. Dr. Leno is here. He is a program officer. I have another program officer who is in charge of neglected tropical diseases. So when we're battling with financing, I set up about 3 committees. One of the committees I set up under that was resource mobilization committee. And we're not making any headway. So at one of our meetings, I said, I forgot to ask, do we have somebody who is coming from Ministry of Finance on this committee? They said no. I said, immediately, let's get the representative. We wrote, they gave us a rep. The first day the rep was going to participate, I asked them that on the agenda, we are not going to talk plenty, we are not going to speak grammar. What I want is a program officer for Bruno ulcer, then the program officer for leprosy. Just prepare your slides. Don't add plenty grammar. The pictures is the pictures I want. When they presented the picture, the man was shedding tears because they didn't understand how much the neglected tropical diseases, even though it doesn't form part of those who have high mortality, but they maim, they disable, and they make individual economically unuseful, adding to the portfolio of the economic burden of the nation. From there, when he left, we're no more talking to him. He was now the ambassador at the Ministry of Finance, pushing for funds to come because he had understood it. And so this is the way I want us to look at today's meeting, that from your corner, from your end, how can you relate and how can you contribute so that at the end of the day, we all make sure that we reduce the burden. And sometimes when we are talking, particularly you, those of you who are not in the health space, sometimes when we are talking about NCDs, you forget that road accidents, they form part of NCDs. And just yesterday in the evening, I don't know whether you people have heard it, one ambulance that crashed into another vehicle and 16 people lost their lives. 16 people, they lost their lives. And so don't sit alone and think that, oh, that's the issue or a matter related to health. We all have contribution. And as I have alluded, wherever you are, you can contribute to this efforts in making sure that we reduce the burden of NCDs. Starting from yourself. If you have not been doing physical exercise, you have to start that. So on this note, ladies and gentlemen, I'll beg leave of you because in Ghana, as we say, Obia want to master. So when your master asks you to go and do something, you can't say no. But I think our senior officers are here, and after the deliberation, Laurent, I think that will do postmortem of this meeting. Thank you very much for your attention. May God bless you.
Thank you very much, Dr. Hafiz Adam Tahir. You've done two things in one. Welcome at the same time the keynote address. All right, so I'm once again excited to introduce my own boss. Like I said in my intro, it's a collaborative engagement between the Ministry of Health and the NCD Alliance Ghana. My own boss is here, and let me introduce her. Dr. Mrs. Beatrice Yoafi Adai is a distinguished Ghanaian medical doctor, breast surgeon, and leading advocate in the fight against breast cancer in NCDs. She is the founder, president, and chief executive officer of the Peace and Love Hospital, with branches in Kumasi and Accra, a specialized facility focused on breast cancer diagnosis, treatment, counseling, rehabilitation, and related care, established in 2002. She also founded and leads Breast Care International, a non-profit organization dedicated to breast cancer awareness, prevention, early detection, and support across Ghana. With over 35 years of experience as a medical officer from 1989, she has specialized as a breast surgeon and consultant in breast cancer management for more than 2 decades. She is recognized as Ghana's first female specialist general surgeon and a pioneer in breast cancer advocacy in Africa. All right, so Dr. Yaku reminds me of one of my pastors, Prophet Yawano of ICTC Holy Ghost Temple. She doesn't like introduction. When you start, this house, she also, approaches the podium. So, Doc, let's have your welcome. Thank you.
Thank you so much. And after the keynote address and the welcome from my very good friend, Dr. Hafiz, it makes my work very easy. Distinguished ladies and gentlemen, standing on all existing protocols, and on behalf of the NCD Alliance of Ghana, it's my great honor to welcome you to this historic national forum for non-health actors in non-communicable diseases in Ghana. Today marks a defining shift in our national response to NCDs. For too long, non-communicable diseases have been seen as a health sector problem. For the first time, we are meeting without Dr. So and so, Professor so and so, scientists so and so, the academicians, but rather the people who matter, the people we normally ignore. I'm happy Delta Airlines is here because they understand it and they've been supporting breast cancer fight for so many years. We need more such partners. Yet we know that the drivers of NCDs, which are unhealthy diets, physical inactivity, harmful use of alcohol, tobacco exposure, including shisha. I was shocked to see shisha being sold in Kumawu and Ejura. So we have a long way to go. Environmental pollution, urban design, trade policies, and education systems. These lie far beyond the hospital walls. NCDs are not only a medical crisis, they are a development crisis, an economic crisis, and a social justice issue. This is why your presence here is very powerful. When the Minister of Finance shapes fiscal policy, it influences food systems and health taxes. When education reforms curricula, it shapes lifelong habits. When local government designs our cities, it determines whether citizens walk safely or sit in traffic. And I'm happy our keynote mentioned the fact that accidents are also part of the NCDs. And it's about time we had places where motorbikes and bicycles will use instead of us all using the same lane. And when industry innovates responsibly, it protects generations. In short, health is created in boardrooms, classrooms, marketplaces, and communities, not only in clinics. Today, we are not gathered to assign blame. We are gathered to build bridges. We are here to foster policy coherence, shared accountability, and collective action. Let this forum signal a new era where non-health actors are not just stakeholders, but co-architects of Ghana's NCD response, where prevention becomes embedded in agriculture, trade, education, transport, and finance, where partnership replaces silos. Together, we can reduce premature deaths, and it's alarming the number of people we are losing. When you hear the statistics, just picture the statistics as our loved ones who are standing behind these statistics. And we are losing a lot of loved ones. We need to protect productivity and secure a healthier future for our children and our children's children. I warmly welcome you, and I look forward to bold conversations and practical commitments. Let's be bold. Let's say it as it is. And let's move from here as moving with some new dimensions and new approaches. Thank you so much for that.
Thank you very much, Doctor. We want to at this moment have a group photograph. And what I took from the presentation, let's be bold and say this as it is. This sounds too familiar with advocates. I don't know if people in government can do the same. But can we all come to the front here and have a group photograph? Dr. Happy, you have to be part of. Can we have some chairs here?
Where is standing all in front there? They do reflect right.
Yeah,
So bring the poster back. Then it's quick. This is something about to do. So that's how come they are beings. So I think people will bring the class.
Laura, material. Professor, before please, can we have you over here as well? Yes, all of us are part of the group photo. If you please. What do we say? Let your smartphone drive. So everybody say hi. They don't want. Say hi. Wave. Hi. I think we had a little bit but everybody say hi. Yeah, you are coming home. Okay, last one. Hi.
Use my dressing.
All right, so thank you very much. We will still continue with the program. We will want to follow exactly with the program outline. We are going to take statements from some of our partners that we've been working with in this space for over the years. But before then, let me do this short acknowledgement. We have, in terms of the media houses present, Business and Financial Times. We have GBC as well, Atlika and GN. These are the media partners we have this morning. And on the collaborative aspect, we have MOH, UNAM and Harry NCD Alliance Global as well. And we also have Dr. Joel Soma, setting from Drammen Hospital, Norway. Dr. Soma, can we have you by wave? Thank you so much for passing through. It's been mentioned earlier on by my colleague from the SASMIT that today marks World Obesity Day. World Obesity Day. All right. Let me introduce my first speaker for the statement from our partners. This is from the WHO. We have Pascal Kinsley from the WHO. He's a highly accomplished medical doctor, so let me add the doctor, sorry, Dr. Pascal. Epidemiologist and health leader, currently serving as the technical officer for NCDs at the WHO country office, with over a decade of experience in clinical practice and public health intervention. Dr. Pascal has been instrumental in shaping health outcomes in Ghana. His expertise span NCD prevention and control, infectious disease surveillance, and maternal health, backed by advanced degrees, including an MPhil in applied epidemiology and disease control, and an ongoing MS in public health from the London School of Hygiene and Tropical Medicine. Dr. Pascal, you are a big one. Can we have you for your statements? Thank you so much for passing through.
Thank you very much, and good morning, everyone. I would like to stand on existing protocols already established. I bring you greetings from Dr. Fiona Branca, who is the WHO country representative to Ghana, and the entire NCD team of the Ghana WHO office. The World Health Organization would like to commend the Ministry of Health and the NCD Alliance Ghana for convening this all important forum to deliberate on issues on non-communicable diseases, which is affecting us globally and in country. As we are all aware, 45% of deaths in Ghana are due to non-communicable diseases, especially cardiovascular disease, diabetes, the cancers, chronic respiratory diseases, among others. It is therefore refreshing that this all-important forum has been convened, not for health care workers, but for non-health sector actors. And at WHO, we are more than happy that this has come to bear. Addressing NCD requires a multi-sectorial action. Many of the drivers of NCD, including tobacco, unhealthy diets, harmful use of alcohol, and physical inactivity, are influenced by a lot of policies and decisions taken outside the health sector. This highlights the importance of engaging sectors such as education, agriculture, urban planning, transport, trade, finance, our academic institutions, just to mention a few, in the national response to the NCD. The World Health Organization remains committed to supporting the government of Ghana, particularly the Ministry of Health and the Ghana Health Service, to strengthen the prevention and control of NCDs in Ghana. WHO continues to provide technical support in areas such as national policy development, the surveillance system that includes the WHO steps surveillance that is supposed to be conducted within some periods of time in country. We are also supporting the Ministry of Health and the Ghana Health Service to implement the WHO package of essential non-communicable diseases, primarily at the primary healthcare level. As we also continue to provide technical and financial support to the Food and Drugs Authority in controlling tobacco-related activities in country. We urge that we all come on deck and provide our tiny little bit of support in order for us to reduce the burden of NCDs in country. As Ghana advances its commitment towards universal health coverage, preventing and controlling NCDs will remain essential to improving population health and sustaining national development. WHO therefore welcomes this platform as an opportunity to strengthen partnership and promote multi-sectorial collaboration to reduce the burden of NCD in Ghana. The World Health Organization stands ready to continue working with the government of Ghana and all other partners in health and non-health sector in advancing the national NCD agenda. We thank you all for being present and the organizers of this very important forum. And we look forward to a fruitful deliberations and discussions and hope that the actions that will be taken from this particular meeting will continue to collaborate and make sure that these actions are implemented for us to reduce the burden of non-communicable diseases in Ghana. Thank you.
Thank you very much, Dr. Pascal Kinsley. We are grateful for your support all these years to WHO. Thank you so much. All right, so the next has to do with Dr. William Omani Obiekum, serves as the acting head of operations at the Ghana Medical Trust Fund. He is a clinical pharmacist and health financing expert with over 22 years of experience running healthcare delivery, insurance and health systems management. He plays a crucial role in leading benefit designs, operations, and claim system. Your office has, over the recent years, been, one of the, let me say, common names in, our household. Mama cares, mama cares. So whatever you say here will mean a lot to us, Dr. Mani. So let's get the remarks. Thank you.
Thank you very much, and good morning to everyone. Let me ride on the existing protocols that have been established. As you listen, we've listened to a few speeches and then the keynote address. And one thing that stands out is what Ghana is doing as a country towards NCDs, the direction we are going in terms of NCDs. And at this point, you realize that Ghana has taken a very bold step in that direction by the establishment of the Ghana Medical Trust Fund through an act of parliament. The fund has been established to complement what is being done already within the space. But then it is a bold step by government because now we have legislation, we have sources of funding directed towards NCDs in particular. This actually demonstrates the government's commitment to addressing an issue that is more or less killing each and every one. I mean, in the past years. Now we are talking about almost 45% of Ghanaians dying as a result of NCDs. And any responsible country would take steps to address this. So I stand here on the ticket of the Ghana Medical Trust Fund, and in the name of the administrator, Madam Ajua Obubiada Kumpu, who for some other person commitment could not make it, so I had to stand in for her. Our mandate as a fund, I just want us to understand why the government had to go the direction we went. Our mandate as a fund is first and foremost to support persons living with NCDs. And if we listen to all the statistics that were mentioned, then you realize that people living with NCDs, all research have shown that people actually are impoverished as a result of NCDs. And so there was a need for an intervention that will support persons who are living with NCDs. So that is one of our core mandates as a fund, to support persons living with NCDs. The next is there is a lot of inequities in the distribution of expert specialists across the country. I mean, from the research we have done, a lot of the specialists are mainly based in Kumasi and Accra and a few other regional capitals. So even when you have the resources to pay for the care, access to the care becomes another problem. So one of the things the fund was established to do was to promote training of specialists of all cadres of health staff, and then equitably distribute them across the country so that we could actually not only throw in money supporting persons, because if you are supporting persons and they cannot have access to the care, I mean, then what are you doing? If the person has to travel from, let's say, Tumu to Accra before you can receive that care, the cost of traveling alone becomes a barrier to receiving the care. So another thing we are supposed to be doing is to train specialists of all cadre, distribute them equally across the country, establish centers of excellence where treatments can happen. Then we are also looking at research into relevant NCDs. Again, a lot of the data on NCDs and even the medications and the treatment are based on research that were not done in the country. So the fund was established to look into supporting research into NCDs so that we can actually get data, information, evidence that is relevant to us as a people, and then also prefer treatment that will hit the target for us. And then last and not the least, we are also looking at activities to promote the assets. So in terms of retooling our hospitals, in terms of infrastructure, and in terms of giving incentives for distribution of these medical officers and specialists across the country. In a nutshell, that is what the fund was established to do. Within the last couple of months since its establishment, We have gone around the country to do a gaps analysis to find out exactly what are the gaps in the treatment and receipt of care. We have worked around, and very soon we'll be rolling out our programs to complement what every one of you here is doing or has been doing over the years. We are happy to be part of this program today because it is obvious that the task ahead is bigger than one person or one institution. Merely establishing one institution will not be the solution to the problem. So we are happy to be part of this group, and our doors are open. We want to collaborate with you on all fronts so that together we can bring our efforts together to address this very canker, which is more or less becoming a national issue for all of us. So we thank you for this day, and I hope that we'll be listening through. And since we are still at the design stage, a lot of the comments you are going to make here will inform the design before we roll out. So we'll be listening attentively to the discussions, and we hope that by the end of today's session, we would have learned a lot from the non-health actors, because a lot of the time we only hear what the clinical experts and what have you say. But when you hear from the other side, it informs what you are going to do. So I think for us in the Ghana Medical Trust Fund, this is a very good opportunity for us to learn, to hear, to listen from the non-actors of health on this issue of NCD, so that they will help us with the design and the implementation of the fund's activities and programs. So I wish all of us a fruitful deliberation as we go forward into the day. Thank you.
Thank you very much, Dr. Omani. Thank you so much. Yes, there is so much expectations on your secretariat. Very important. Okay, so last, speaker on the partner statement. She's someone I've known over the years, and as part of the work we do as Ghana NCD Alliance, we build capacity of people with, disease conditions to speak for themselves. Often, advocates do the advocacy for such people, but we are putting a step further by building their own capacity to lead their own advocacy. We have one of them here. I don't know, but I believe in this section so much, especially where you share the power of your lived experience. I don't know where she's going to take us this morning, but Catherine Berku is a passionate advocate for women's health, particularly in raising awareness about endometriosis. As the founder of Endo Charity, launched in 2018, she dedicates her efforts to educating women about endometriosis and empowering young girls to become change agents. Berku's advocacy stems from her personal journey with endometriosis, a condition she lived with for 21 years and was misdiagnosed for 11 years. Enduring 8 surgeries, her experience highlights the critical issues of delayed diagnosis, which often takes 7 to 10 years due to the misconception and menstrual pain. And that menstrual pain is normal. She firmly accepts that pain cannot be normal, and emphasizes the need for society to take women's pain seriously. You'll be amazed. She's 51 years, or she'll be 51 this particular year. Catherine, can we have you for your statement? Let's welcome her with a clap of thanks. Yeah, very young. She'll be 51 this year. Yeah. But she looks like 40. Sweet 40. Yeah.
Thank you very much. I'm very happy to be here this morning. I feel very relevant in this meeting for once in a very long time. So I'm very happy to be here. This is indeed an era brewing. I'm here representing people living with NCDs. I'm going to keep it brief though. Distinguished leaders, partners, and colleagues, I stand before you not just as an advocate, but as someone who understands what it means to live with a non-communicable disease. For many of us, NCDs are not statistics in a report. They are daily medication. They are routine hospital visits. They are lifestyle adjustments. They are financial strains. There are moments of fear and moments of strength. Conditions such as hypertension, diabetes, cancers, chronic respiratory diseases, sickle cell disease, and endometriosis are rising in our country. Yet the response cannot remain the responsibility of the health sector alone. Because NCDs do not start in hospitals, they start in our food systems, in our schools, sorry, in our workplaces, in our communities, in, in the policies we make or fail to make. Today, on behalf of the people living with NCDs, I want to clearly state our expectations of non-health sectors. First, we expect leadership beyond the Ministry of Health. When the Ministry of Finance makes budget decisions, when education leaders shape curricula, when businesses create workplace policies, those decisions directly affect our health. We need economic policy that protects families from catastrophic health spending. Long-term treatment should not push households into poverty. We need schools to teach health literacy early so prevention becomes part of our culture, not an afterthought. We need cities that make physical activity safe and accessible, and food environments that make healthy choices easier. We need employers who understand the people living with NDCs. We need, sorry, we need employers who understand that people living with STDs are productive, valuable members of the workforce, and who provide supportive health insurance and flexible work arrangements. We need the media and community leaders to help reduce stigma. Living with a chronic condition should not come with shame. Above all, we expect genuine multi-sectorial collaboration, not symbolic meetings, but structured partnerships with measurable targets and accountability. And we must say this clearly: nothing about us without us, meaningful involvement. People living with NCDs must be included in planning policy development and monitoring. Our lived experiences provide insights that data done cannot capture. We are not asking for sympathy, we are asking for empathy. We are not asking for charity, we are asking for systems that work. In Ghana, if Ghana is to achieve true universal health coverage and sustainable development, then addressing NCDs must become everyone's responsibility. Because when one person's health fails, productivity declines, families suffer, communities weaken, and the nation pays the price. But when we invest in prevention, supportive environments, and inclusive policies, we build a stronger Ghana. Let us move from paperwork to action, from discussion to measurable commitments, from isolated efforts to coordinated national response. Together, we can reduce the burden of NCDs. Together, we can protect families. Together, we can build a healthier future for Ghana. Thank you.
Thank you very much, Catherine. Indeed, together we can do much. Two is better than one. That scripture is not just for married couples. Yeah, whenever we come together, we are able to do more. I saw a lady smiling behind. All right, so the last one will be done by our rep from the NHI, a colleague I knew some years back working in CSN, but now works with government. Madam Eunice Nkrumah Abba, Deputy Director, Strategic Purchasing Directorate of the National Health Insurance Authority. Madam Eunice, let's have your short, brief statement. Thank you.
Thank you very much, sir. It's an honor to be back here. I think I've been an advocate over the years with the Labram and team, and it's always good to be back home. Standing on all existing protocols, good morning. NHIA has been very committed to NCDs, and as we are all aware, we have a very big benefits package that takes into consideration so many of the diseases that cover NCDs. So this morning we are here to continue to support and committed to this work because every year or annually we pay a chunk of our claims we have a chunk of our claims coming from NCDs. And when we look at how critical this issue is, it's very good that we work together to move this cause forward. So once again, we pray that we have a very good discussion this morning that will move the cause of NCDs forward. Thank you.
Thank you very much. Some years back, Madam Eunice speaks long and with so much of action. But once you join government, there's a way you have to speak. Thank you, Madam Eunice. Yeah, I understand. Yeah, oh yeah, Prof. Prof, I thought the statement I made was very harmless. Yeah, basically. I've always been, my boss in the office been asking me, Charlie, government keeps giving me pressure. They want to work with me. But I keep telling you, once you go and join government, the spirits of Labram that we know will vanish. Oh yeah, because I can speak on authority. I know a lot of my church members who assume certain position in government, and their conversation change. Prayer warriors tend to be propagandists, and you can't fight it. I don't know what is in government. Probably when Prof takes over, he can share a very brief, something that some of us have no idea of. That once you get into government, you are unable to speak like an advocate. You are limited. All right. We want to go for our health break, but let's take this last one from the Mental Health Authority. Is it Madam Priscilla Tama? Can we have a short statement from you? Thank you so much. Sorry that you speak your name earlier on. We should have addressed you earlier. Thank you.
Thank you. I'm Priscilla Theria. Good morning. Please, how are you coping? How are you coping? We thank God. So that brings us to mental health. When we talk about mental health as defined by WHO, it's a state of well-being in which the individual realizes his or her potential, can cope with normal stresses in life, can work productively and fruitfully, and can also make contribution to his or her community. So that's mental health. Formerly, I've been seeing NCD and mental health. I don't know whether they've now dropped the mental health or they are assuming it's inside. So now when we mention mental health, when we mention NCD, mental health is part of it. On behalf of my chief executive and the deputy chief executive of the Mental Health Authority, I wish to say that Mental Health Authority is highly committed to non-communicable diseases management. And we are happy to be here and to represent in this important forum. So not to bore you, this forum for non-health actors has come at the right time and is very important. So as other speakers spoke earlier on, always when we talk about health, health is in our domain, is in our custody. Hospital is like a fitting shop that you go. If your vehicle you are not able to manage it, then you go to the fitters to fix whatever for you. But health is in our domain. So this National Forum for Non-Health Actors on NCD could not have come at a better time, with NCD steadily increasing and affecting families, workplaces. And workplaces, when we talk about workplaces, workplace mental health, that's when you have presenteeism or absenteeism. You say I should come, so I'm here. So whether I work or not, or I will not come at all. So that's absenteeism. And communities across the country, it is clear that the solution goes beyond hospitals and clinics. It's in our domain. Health is shaped by the decisions we make in education, agri, when you marry, where you live, how you manage your anger, where to go, how to make yourself happy, how to manage your stresses, because life is full of stresses. Earlier on, we heard about using shisha all over. Some people thought when they use it, they can use it to distress, but that's not appropriate way of distressing. So appropriate way of managing your stresses. Sometimes in process of managing your stresses, you fall into another stress. So by bringing on health actors together through the leadership of the NCD Alliance Ghana in collaboration with the Ministry of Health, this forum creates a valuable space for honest dialogue, shared learning, and collective commitment. It sends a strong message that reducing the burden of NCD is everyone's business. So we all have to take our health into our hands. How to get up and walk, do exercise, what to eat, what not to eat, what to drink and what not to drink, how to manage your finances, how to invest, whether you invest into a Ponzi scheme, so that whatever. So all collectively indicates whether you have good health or you have ill health. So always when we talk about mental health, then our minds go to those on the street. So there is a great difference between mental health and mental illnesses. So as I defined earlier on, that's mental health. So the opposite, if you are not able to cope with the stresses, that is where you need help. You don't need to stay until you are not able to control your stresses yourself and others will come in to help you. You have the power to manage your stresses. So on that note, we wish all of us a good deliberation so that we know how best we can manage our health outside the hospital. Thank you.
Thank you very much, Antelia. It's a wonderful one. As part of the work I do as an advocate, I'm a grassroots person. I engage the community more. I met this young man and we were chatting, speaking about alcohol, tobacco, sugar-sweetened beverages. And like the encounter Jesus had with one man in the Bible, he said, I do all this when I was very young. And he said, there remain one thing, go and sell all that you have and give to the poor. And the guy said, Charlie, he said, so then you're a very good guy. I said, but there's one problem. Women is no problem. I said, that one, I cannot handle it. He said he doesn't smoke, he doesn't drink, he doesn't do, but then when it comes to women, he has a shortfall. And I was having a chat with a journalist this morning before the program started, that you can do everything within your mind, stay away from certain vices. But old age is even an NCD. Yeah, and it's something we hardly talk about. When you get to a certain stage, the body will tell you that I'm tired. There's nothing you can do. Yes, and these are practical things we have to always come to the table with. Today you may be strong, tomorrow you can never tell. All right, thank you so much. We'll go for a short break, 15 minutes at most, 15 minutes. Then when we come back, we'll hear from two other presenters and then we'll open the floor for questioning from especially the non-health access institutions. Thank you very much. So you can go to the back, just go to the back, get something, grab something and come and sit. You can also use the opportunity to mingle and share. When we did the introduction, probably there was an institution you heard of. You can get close to them, get to know them, take contacts.
Typically, it's associated with sex. You see, age at first intercourse, early marriage, polygamous relationship, multiple sexual partners. Okay. But the good news is that we have vaccines for HPV. It's not in our immunization schedule. They are now trying to add it. So with that, if we give it to the young girls, then that would help. And I must also say that, like, if you go to the US, the HPV, they give it to boys and girls, because it also prevents other diseases in the boys. In the UK, they don't have a lot of money, so they give it to only girls. Okay? But if you give it to boys and girls, in terms of the community protection, is higher. Okay? All right. And you can see, come on. All right, so that's it. So prostate, that is us. Shamoba. So again, it's one of the leading causes of death. The mostly over 60, black, family history, sedentary lifestyle. So you can see again the exercises is coming through. And then they also tell us that when you ejaculate regularly, it helps more. So, but then that cannot be a public health strategy, isn't it? So prevention, exercise, good diet, and then you screen. All right, so let's look at liver cancer. Liver cancer is also one of the cancers that when you get, if it's late, it's extremely difficult to manage. And normally, most of our liver cancers is coming from cirrhosis. And you get cirrhosis where the liver becomes very spongy. And it comes because of hepatitis. I'm sure you heard about hepatitis. So hepatitis B in particular is B and then C. Fortunately, from 2001, Ghana started introducing hepatitis into our vaccination. So we think that over time, cancer of the liver in the country will go down. Yeah. Because normally, if you get a hepatitis, it takes 20 years for the cancer to show up. So you see, it takes a long time. Yeah. Then alcohol is a big one. So if you drink 5 units or more, 5 units or more daily, do you know what 1 unit is? 1 unit is a tot or beer, mini, or a glass of wine. It's all 1 unit. So if you are drinking more than 5, then you know your smoothness level. Then aflatoxins. Do you know what aflatoxins are? The mold. You see the mold in the maize. Those ones are also can cause. And then the plastics. The plastics is a very big deal. Now we have soup in plastics. We have also cocoa in plastics, and then we eat it. Okay, so that is a major. So now, if you go to Legon now, some of the places we go, instead of using the this thing for the banku, they use leaves. They use the leaves to. So these are all little things that we can do. Okay, all right. Smoking is there again. So strategies, alcohol intake, smoking, plastics, and then we screen. Okay. Lung cancer. Lung cancer is one of the first cancers that was linked to smoking. It's extremely rare to find somebody with lung cancer who doesn't smoke. However, there are some types of lung cancers that is not associated with smoking. There's something we call mesothelioma. Mesothelioma. Mesothelioma is caused by asbestos. Do you know what asbestos is? Your grandmother's building, you see the slate on it. You know Osuriga. You know the company next to Osuriga. How do you call it? Kitani. Yes, Kitani used to produce asbestos. You know that company is shut down because when you found out that asbestos is carcinogenic and they stopped. Okay, so you just need to avoid contact with those. So smoking and then reducing the exposure. So the general principles is that you need to reduce the risk. And the risk, you can reduce it in the home, you can reduce it at the workplace, you can reduce it in the community. And that is where we all come in. Then the early detection. I mean, we need to screen early. We need to create that awareness because you only screen when you know. If you don't know, you won't screen. Okay? And then timely referral. And then, of course, you will require money. Then also treatment, because after you've done all the screening, one of the principles of public health is that you don't screen and then you don't treat the person. So when you screen and you find, you must treat. Okay, so it means that we must make sure that the treatment is there. You must make sure that it is affordable. You must make sure that it's accessible. Okay. Mental health. Mental health, are you there? So I put that for you only. Okay, so she's defined what mental health is, and then what mental health disorders. Okay, if you look at the Ghana data, you see the issue with mental health is that unlike the other non-communicable diseases that will kill you, mental health will insure you, or the Nigerians will insure you, to wound you and insure you. You understand? So normally they die, it's normally from suicide. Okay? But normally they don't lead a productive life. You see, and sometimes we forget because if you look at the mortality data, those who are dying, mental health will show at the bottom. But if you say people who are unwell, mental health will show up at the top. Okay, so there's the schizophrenia, there's the bipolar, and then depression. And then one of the things about these NCDs is that one person can have like 3. One person can have multiple NCDs. And that is why, and since the risk factors are all similar, that's why normally when you do one intervention, it can affect multiple diseases. All right. So these are some of the things we can do. I mean, there's a lot of stigma. So community awareness, community outreach, and then also looking at the policy level. How can we integrate mental health at the community level? How can we integrate mental health at the primary healthcare level? So I had key message. So NCDs is killing Ghanaians, it's taking a lot of people to the hospital. And the painful part is that the people who are dying are in their 40s and 50s. That is when they are most productive. And we are losing a very, very productive population. So now the behavioral lifestyle modification, these are the modifiable risk factors. We can do something about it: smoking, alcohol, physical activity, diet. And then the health promotion at the community level. We need to promote the health. We don't have to wait to go to the facility. By the time you go to the facility, it will be too late. So let's do that health promotion. And it's good that NHIA is pushing a lot of work in this area. And I think we need to do that. And that will have to do with can we walk around in our communities? Can we exercise in our communities? Okay, all right. Then the screening, the early detection, and then also making sure that the health systems, that the access, the equipment, the people, like it was said earlier, most of the specialists are in Accra and Kumasi. So if I'm in Warum, what kind of? So then we have to start looking at integration of services. All right. Then the resource allocation, we really need to make money available. And then if I have hypertension, I don't have to go to college. I should be able to go to the nearby clinic. And we've done some work where we actually have managed hypertension at the community level. You see, so we really need to try and integrate it at the basic level so that everybody will have access. I think together, all of us can put in our shit to stop NCDs. Thank you.
I think we can do better for him once again. Thank you so much, bro. That was very insightful. There were two things I did. I didn't know he would speak down so well. I could hear Martha, highlighting. You don't come here now, Lori. Come here now. All right. So there were two things I did. I don't know about you, but it has to do with awareness and then the physical activity aspect. Often we talk of low awareness. As advocates, one of our challenges has to do with funding. I feel like awareness, interestingly, should be a year-round activity. Usually we take advantage of the global health celebration of observational days, to do one or two awareness and then we go back to sleep. But it should be a year-long, something that we must see all over. And then physical activity, for those of you who knows us very well, in our office every Thursday, between the hours of 4 to 5, every staff, you would have to engage in physical activity. We train in the office every Thursday. Yes, every Thursday. I was happy to know when we engaged Pat Ghana recently, they also do same every Wednesday, 12, wherever if you're on the food, they have a name they call it, something Wednesday, something afternoon. Whatever you have to observe the physical activity. It is something we can practice, but some of these things comes with a whole lot of discipline. It is not that easy to shun or leave an old habit. So what we want to do is want to take the next two presentation afterward, then we open the floor for questions, suggestions, and way forward. Our next speaker, who happens to be a doctor as well. I love to see young people who are doctors. Yeah. And, he is presenting on NCDs beyond the health sector. All right, so we have Dr. Ole Nuwalis, Odipo, Ashite Odipo. Is a prominent public health leader currently serving as the acting program manager for. All right, thank you.
Thank you. Good afternoon. I bring you greetings from the Director General of Ghana Health Service. He was supposed to be here, but unfortunately, he's in another meeting. Could you kindly proceed, please? So the aim of my presentation, the professor has laid a very strong foundation for NCDs. So the aim of my presentation is just to underscore the importance of multi-sectoral action in NCD prevention and care. You realize when he was talking about the risk factors, he spoke about a lot of the alcohol, tobacco, a lot of those risk factors are outside the control of the health service. The health service, we are like the people mopping the floor. When people leave the tap open and the floor gets wet, then we have to mop. But in order for it to stop, we need to close the tap. So we want to see who opens the tap and who can help us to close the tap so we can stop mopping. And my presentation, please. Yeah, so whilst we are waiting for the presentation to be put on, I also want to say that NCDs are becoming a worrisome part of our health system. And as a sister from NHI said, a lot of the money goes into NCD care. And the sad aspect is that we pick up a lot of these cases very, very late. You see, we pick up a lot of these cases very, very late. Dr. Yafi said she will tell you the breast cancer cases are always very late. You see, and there are opportunities in the system to pick them up early. And the opportunities doesn't only lie with the health sector. That's what you want to do today. That's what I want to tell you today. The opportunities doesn't only lie with us. It lies with civil service organizations, with other ministries as well. Apologies, ladies and gentlemen. I think we have a little bit of a technical hitch. They are working on it. Okay, let's continue. When we are ready, we'll just plug in. So my presentation objectives are to provide a brief overview of the NCD burden. Professor spoke about the burden, but I want to contextualize it in the Ghanaian with the Ghanaian data. We also highlight what continuum of NCD care is, and then I'll also explain why the health sector alone cannot solve the problem. And then we'll define, we've heard of non-health actors, but we want to know who they are, and they want to demonstrate how their actions and these actors can influence NCD outcomes. And then we also present some practical examples, activities that they can do to be able to help us reduce the morbidity and mortality of NCDs. So we've been told what NCDs are. They are a collection of diseases that cannot be transmitted from one person to the other. And we have classified them because they share common risk factors. So for example, if you smoke, you are likely to get lung cancer, but it can also exacerbate asthma if you have asthma. If you drink, you are likely it will expose you to a lot of other cancers apart from liver cancer. Alcohol is a risk factor for a lot of diseases as well. If you are obese too, it will expose you to not just one type of cancer. So they share common risks. They share common risks. And they are playing a very critical burden, placing a critical burden on our health system. There are so many. Yeah, so I've done this already. Yeah, so there are so many NCDs. There are more than 40, but we have our priorities because when we look at the data, we look at the ones that are high burden for us. When Professor was presenting, he presented the cancers globally, but he zoned in on the ones that are common in Ghana. So in Ghana, these are our priority NCDs: cardiovascular diseases, diabetes, cancers, and then injuries, like he mentioned, injuries, and then mental health conditions. Mental health conditions are part of our priorities here. And these are the risk factors. I think what was left out was air pollution. It's also considered one of the major risk factors. And I'm happy EPA is here because it's one of the things we are really worried about. And he spoke about modifiable risk factors, etc. And then about race, etc., etc. So, what are the key features of NCDs? The financial burden on patients and families. If you are diagnosed with a disease that has to usually long, chronic, and it will stay with you for maybe the rest of your life, you can imagine what will happen. You have to hospital visits, etc., etc. And then the NHI covers most of it. But you can imagine sometimes the implementation is not as we all know. So sometimes you still have to do out of pocket payments. Long-term management, because they require regular long-term management, you have to go to the hospital every month, every 3 months. Along the line, some people give up and then they give in to other herbal and other therapies that are not recommended. You see, because they grow tired and they try to seek alternative care. So that's one of our problems. And late diagnosis and delayed care. When people check their blood pressures and they see the numbers, some are in disbelief. They want to go and ask their pastor if they should start taking the medications. They want to go and ask their ancestors if it's true that they have hypertension. By the time they come back, they have some complications. You see, so something that was picked up early still may end up coming with a complication. Also, limited access to specialized care. Realize that you need specialized care for a lot of these NCDs. If you have cancer, you need an oncologist, and they are not evenly spread in Ghana. The distribution is not equitable. So you can imagine living in a place where you don't have access to specialists. You are already disadvantaged. And then I was talking about the financial burden already. These are the drivers of the NCD. The professor has spoken about it, but I just want you to see where we stand as a country, because the latest figures we have is from the 2023 World Health Organization STEPS report. It was a nationwide STEPS report. So this is where we stand as a nation. I'll just focus on a few. So alcohol. So you see, people think that people in the rural areas don't drink alcohol, but you see, it was rural consumption was more than urban consumption. So the alcohol units and the rest they are able to find their way there. Tobacco use. People think our tobacco use here is low, but look at second-hand smokers, because people are not abiding by smoking regulations. That is why it's important that you have multi-sectoral action, because the health sector doesn't have the mandate to go and penalize people who are not adhering to tobacco laws. So NCDs, like you say, is no longer a health sector issue, because it affects the economy, productivity, national development, and household financial security. I know someone who was diagnosed with prostate cancer, which is not on it's not on NHI. So everything about it has to be borne out of pocket. And if you have experience with the drugs for treating prostate cancer, you know what I'm talking about. So we need broad national dialogue and commitment from all sectors. So this is what we call the NCD continuum of care. It starts from prevention, early detection, accurate diagnosis, treatment, survivorship and rehabilitation, palliative and end-of-life care. So you need multi-sectoral action across the continuum of NCD care. But realize that a lot of the efforts will be around prevention and risk reduction. You see, you have primary prevention, secondary prevention, tertiary prevention. Even before people get access to those things that will expose them to NCDs, which sectors are responsible for even allowing those things into our country? How are they regulated, etc.? It's very important. So this is the burden. We've gone through it. I won't go through it again. So there are key global concepts that are shaping the response. You see, a lot of the things we are doing are things that have been sanctioned globally. The first one is the SDG. I know most of us are aware of it, but if you are not, SDG Goal 3.4 says we should reduce premature NCD deaths by one-third by 2030. 2030 is just for years away. And if you look at the data, more almost now it's up to almost 50% of all cause mortality in Ghana is due to NCDs. So if we want to achieve reduction by one third, we have to do more. And the answer is in multi-sectoral action. We have what we call the WHO NCD action plan. We have universal health coverage, where people do not have to suffer financial hardship just because they want to seek care. Because financial hardships are also one way in which people are unable to access care. And later on, we'll talk about some of the new financing mechanisms that we are introducing into the country to be able to abet this. We have a national NCD policy. It has a vision, mission, and goal. Let's look at the objectives of the policy. You realize that there is strengthened multi-sectoral collaboration for NCD prevention and control. So if you are here today, it's not by chance, it's because we need to approach this thing through a multi-sectoral approach. So I'm just giving you some of the data from Ghana between 2023 to 2025. Hypertension and diabetes continue to remain our high burden NCDs. Hypertension and diabetes, they continue to remain our high burden NCDs. And the sad thing too is that the cancers are also creeping in. You see, so if you look at the ones that I've highlighted in red, which means they are getting worse. So you see where you see dental caries. A lot of, I don't think Bob mentioned oral health, but oral health is also part of NCDs. Dental caries, what we call caca. People are really having a problem with it, and your mouth actually reflects the health of your body. There is sickle cell. Let's look at the mental health disorders, and then prostate cancer. Because of the health seeking behavior of men as well, we think what we are seeing is just the tip of the iceberg. There are so many people who have the condition, but men, you see anything that has got to do with a manhood, it's very difficult to approach the health system. So that doesn't mean the health system is not doing a lot. We are doing a lot. We have the policy when Dr. Pascal was talking about what the World Health Organization is supporting the country, he mentioned pen and pen plus. What it means that we are trying to strengthen care at where you live. So you don't have to travel long distances to access some care. We have started cervical cancer screening, and if you are here, you are a woman, you are here, you are over 30, and you've not had a cervical cancer screening before, please take advantage and go and do it. Because the data shows that only about 3% of women in Ghana have ever screened for cervical cancer. This is worrying. So if you are here, if not screened for cervical cancer and we close, you can see me. I can connect you to a screening place so that you can get screened. We are doing our HPV vaccination, so we are on the right, we are on track. And then I mentioned that we have what's called the Ghana Medical Trust Fund, which is coming to soften a lot of the blows on patients, especially in terms of access to specialized healthcare services. We also have what's called the free primary healthcare, where you can walk into a facility and get screened. So these are some of the advocacy materials we have that we use for education. We have flip charts for childhood cancers. We have brochures for cervical cancer. We have national guidelines on physical activity, etc. So the health system is doing what it can. We have all these policies that we have that helps us to be able to fight this. So the health system is actually doing a lot in terms of fighting NCDs. But the health sector alone cannot win the fight because food systems drive obesity. FDA is supposed to help us to choose. Is anyone from FDA here? Transport systems driving activity. When I used to live in London, I used to be a fine thin boy because when you drop at a place that's far off from you are encouraged to do so, then you walk home. Now, if you go jogging, I know somebody who went jogging on a mountain with a spouse and they were knocked down by a vehicle and they died. It's a true story. See, so our transport systems, the way our roads are constructed, it discourages people from going on walks. Sometimes if you are going on a walk, you see how the cars drive so close to you, they want to knock you. Trade policies, we've spoken about alcohol and tobacco, and then urban planning, urban planning, and then education, and also finance. We need our programs need to be financed because we can't do education, free screening, etc. if there's no money. And then media, the importance of the media cannot be overemphasized. The media is an ally in the fight against NCDs. So, who are the non-health actors? They are institutions whose decisions, policies, investments, and enforcement influence the risk, prevention, and control of NCDs, even if their core mandate is not health. You see, so your core mandates may not be held. But if you look at the risk factors that I spoke about, you realize that a lot of them are embedded in economic activity. So if you are controlling the import of alcohol and tobacco into this country, you play an important role because when people smoke and drink and they get the effect, they come to the health sector. But if you are able to control it and ensure that we do not get access to these things or they are well controlled and regulated, the actions have consequences for health as well. And so this aligns with what we call the health in all policies. You see, which means that policies that are developed even outside health should have health in mind. So there are global policy anchors. I don't want to bore you with all this, but I just want you to know that multi-sectoral action is something that is global. It's evidence-based. And so there are global policy anchors that support multi-sectoral action. We have the WHO framework, Convention on Tobacco Control, we have the Global Alcohol Strategy, etc. So non-health actors, what do they influence? They influence markets and trade policies. So when people bring unhealthy diets into the country, unhealthy drinks, and drinks that are going to make us sick, and they allow it onto the market, they are also doing us a disservice. Tax and pricing. Ghana, I hear we are doing so well with taxation on some of these taxes. And I want us to applaud NCD Alliance, especially Mr. Labram, because Ghana is an example in the African region and even the world. You see, because this taxation has been shown to decrease consumption. And now I think the effort is to try and get some of the monies accrued from the taxation to be channeled to to help. Education system, health literacy, physical activity. I remember when we were all in school, Fridays is PE. You just put your back down, then you run. Now all the children are on tablets. They don't run. You have to force them and take the tablets away from them. So the education system too plays a role. Urban planning. We don't have, if you travel out, I realize that they have parks. You know, even if you are fighting with your wife at home, you can go and sit there for 5 minutes. By the time you go back, you are all relaxed. But here, if you are angry, you get out of there. You don't take a car will even knock you. You even get more angry. We don't have green spaces. We don't have all those things that improve our mental health. You see, so the way we plan our environment will play an important role in NCDK. Our transport systems, media and advertising. I think it's getting better because Mr. Labrama has given them a lot of pressure. They used to advertise alcohol at late hours. In fact, a lot of the stations were not sticking to the rules. So the CSOs have given them a lot of pressure. So the media and advertising is very important. There was somebody who set out, she bought malt, a bottle of malt and a bottle of Fanta, and she mixed it in a plastic bottle, and she took it to a media house for advertisement. They did not check. They just started extolling how good the medicine is. So after she told them that they should drink it, and they realized that it was malt and Coca-Cola mixed together. So this shows that anybody can sit somewhere and have some herbal medication and then bring it to us. So the media, please, you also have to double check. We know that it's important that you get some money from this advertisement. We have to know that are they registered with FDA? Are these products that have been brought to you for advertisements, are they sanctioned by the Food and Drug Authority, etc.? Our workplaces, there used to be a gym at Ghana Health Service headquarters. Now all the machines are broken down, so that's where our cleaners sleep. So you can imagine, yes. So when you close, sometimes you look at the gym and then you walk past. We need workplace wellness programs. It's very important. We spend a lot of time at work. I think some of the organizations have it. They have gyms, or even they negotiate for gym membership, reduce prices for gym membership because it's very expensive to join gyms in Ghana. So it's very, very important. Workplace wellness programs. I read of a CEO in India where I think 30 minutes every day the employees gather and then they crack jokes and laugh. So today you are the resident comedian. You have to go and look for jokes and come and crack jokes so that you release the tension at work. It's something that is nice. I read it and I like it. So what has Ghana attempted in terms of multi-sectoriality? We have an NCD policy that explicitly references a multi-sectoral NCD steering committee. We have that at the ministry and they meet regularly. We also have health taxes. I've already said that. So we have tried. So I just want us to see what the health um, the non-health actors, just some high impact actions we can take from here. So Ministry of Finance, they are sitting on the money. Please give us some of the money to do the work. So we need to strengthen and expand the taxes. And then earmark, it's been a problem. It's been a problem. So Ghana SC Alliance, you have to do your work because earmark portion of excise revenue for prevention, the evidence is showing that we are getting monies from these taxes. So we need to be able to repurpose and realign some of these taxes towards NCDK. Ghana Revenue Authority, they also have to enforce tax compliance. Some people are always dodging taxes. If you are able to maximize the amount of money we get from the taxes, we can also repurpose that and use that for NCDK. Trade and industry too is very important. Regulate food labeling standards. Ministry of Education, mandatory physical activity in schools, because we all know that when you teach a child very early, they get used to it. Yes. So these are their primary pathways of influence. So for Ministry of Finance, they can do price regulation, resource mobilization, and then Ghana Revenue Authority, market control, fiscal enforcement, and then the Ministry of Trade and Industry, the commercial determinants. Because let us be truthful to ourselves. A lot of these risk factor risk factors are embedded in economic activity. They bring some form of revenue to the country. You see, so someone once asked me, Why don't we stop importing cigarettes at all? I think maybe somebody will have to answer me on that. So, Ministry of Transport during driving enforcement, it's very important. Somebody has gone jogging, and these things happen all the time. We hear about it. Somebody has gone jogging. I think last time there was a yes, a doctor went jogging. Apparently, he was hit, and he was found by the roadside. You know, obviously, maybe these people were from the club, they were drunk, etc. Yes, so it's very important. Enforce helmet and seatbelt laws. Right now, all the Okadas we have, just count how many of them are wearing helmets. And in fact, sometimes you even see the police riding with them, even without helmets. So it's very important that we need to do the enforcement. Environmental Protection Agency, air quality monitoring. A lot of people are developing lung coughs, etc. I mean, the air quality is poor in some areas. And then Ghana Police Service, they are the enforcers. So they enforce tobacco control laws, they enforce alcohol sales and licensing laws, and then road traffic safety enforcement. They ensure that you don't drive anyhow, and then when you drive anyhow, they penalize you. So Food and Drugs Authority, their role too cannot be overemphasized. Enforce restrictions on tobacco and alcohol advertising, promotion, and sponsorship. Approve and monitor safe and quality of medicine. Very important, because a few of our clients have said they were on medications and their blood pressures were not improving. But when they changed those medications, realized that the blood pressure was being monitored, was being controlled, which means that sometimes some of these medications are not actually working. So that's what FDA can help us to ensure that we get high, good quality medicines to be able to control our NCDs. And then the media houses, regular NCD education programming is very, very important. Sometimes, I think half yearly, we invite the media and tell them about our efforts in NCD control, because these are lifestyle diseases. So we need to be reminded almost all the time. Every time there should be some advert or some talk about NCDs on the radio waves, or once in a while, we invite somebody to talk about an NCD. So there is sustained interest and sustained dedication. Even with all the noise we make about peak October, do you know the screening uptake is still low, which means that we've left screening to October. But every month of the year, you can do advocacy that look, it doesn't matter what month it is, you still can do your breast screening. So if you are here, if not screened for your breast, please try and do that after today. And then our faith-based and traditional leaders, community screening mobilization. And I've really seen the importance of this. Anytime we have a World Advocacy Day and we involve the traditional leaders, the people come in their numbers because they respect them, our imams, our chiefs, and they respect them. So when we work with them, they're able to uh, bring the people, they're able to dispel some of the myths and misconceptions and bring the people for screening. We had recently had a National Cancer Day celebration, and a lot of women showed up to screen for cervical cancer, which was a big surprise because they felt it was an intimate examination, and a lot of them were not. But when the Queen Mothers came around, they were relaxed and they realized the importance of having it. So it's very important. Our traditional leaders and our faith-based, our reverends and etc., they should actually be allies in the fight. I've not seen any traditional authority here. Mr. Lamar, we didn't invite MOH, you didn't invite him. Civil service organizations, yes. They monitor policy enforcement, and I think they provide the much needed pressure to our government to be able to work, and we really appreciate that. So they also advocate for stronger regulation, and then the most important is the patient support and awareness, because we realize that without lived experience, we cannot make our services better for the population. So we appreciate the CSs in this regard. So the key takeaways, NCDs are shaped by decisions outside the clinic. I've demonstrated that. And non-health actors are frontline influence of risk and prevention. And as I've said, there are global and national policies that urge multi-sectoral action. And then the evidence supports cross-sectoral action for real impact. Thank you.
Thank you very much, Dr. Wallace. William, I hope I got it right this time. All right, so there are a few pointers from your presentation. And the first one has to do with my office. That's the physical activity. That is, I champion it in my office. And there is an aspect, I don't know, I've not been to Rwanda before, but my boss has been there. I'm told once in a month they declare it not a holiday, but then from 6 to 10 a.m., there are major streets in Rwanda that no car uses. It is meant for the community to exercise from 6 to 10. If we could adopt the same concept here, it would help. Sometimes I wonder which street, because our commercial drivers will compete with us. That's where they make their money. And then the workplace as well. When you mention about the Ghana Health Service, that your gym is not functioning any longer. You can exercise without the gym. Dog. You can also write to us. We can have a special day, come with, to meet your staff so that we can have a nice time. The aspect I also love so much, which I do every year, probably we could also do the same in our various, places of worship. Every year I open up discussions with the leadership of my church, which I happen to be a member. The NCD Alliance always come, especially in the month of May. We call it in our church the Life Development Series, in where the whole of the Sundays in May we dedicate it to experts, in various with finance, health. So for the past 3 years, we've been able to engage with the NCD Alliance, and it's been fruitful. We hope will continue this very year as well. So we'll take a last presentation, after which we open up the discussion for other views and comments. I'm happy to do this particular introduction. I do this always not with any stress or struggle, because it's a man I have worked with many years. We have had our good times and bad times. If you know us very well and you come to the office, you wouldn't know who is the boss until you ask and you are told. And he is sharing basically CSO perspectives on the national response and strategies, entry point for non-health sector engagement and investment. Wow, a good topic and very deep. Labra Musa is a leading public health advocate in Ghana. He's a sought-after speaker on global platforms, renowned for his impactful work across several critical areas. He serves as the executive director for the Vision for Accelerated Sustainable Development, and he also doubled as the national coordinator for the Ghana NCD Alliance. He's also the secretary to the ANN. Let me skip the things he does. He belongs to a lot of board, local and global. LeBron is a tireless champion for public health with a strong focus on tobacco control, alcohol policy, road safety, climate change, and the prevention of NCDs. His advocacy has been instrumental in shaping national policies. Recognized for his global contribution, last year he was awarded the World No Tobacco Day Award by the WHO. I thought you clap your hands there. Yeah, LeBron, congratulations once again. And also advancing the cause of universal health coverage in Ghana. His ability to mobilize diverse stakeholders and drive significant policy changes underscores his profound impact on public health in Ghana and beyond. He's a grassroots man. There was a time he was telling me in the office, Solomon, I think I can be a good consultant too. Yeah. I can be a good consultant, especially in program planning and stuff. I said, yeah, you can do it. If your boss asks you something, you don't have to say no. Even if it is no, you say yes, just to fall on safer side. So, Lab, let's have you now to give us a brief presentation. So he's going to do things. He's going to lead us in a physical activity plan a program, after which we do the presentation. Thank you.
So thank you very much, Solomon. Please, can we be upstanding, do some small.
Well, it's a moment. Okay, so because of the classical economy, there's a need for this guy to our homes, our workplaces, everywhere for ourselves. So we definitely want make our meeting without having one prescribed. So I will just briefly go on to our presentation, and I want to believe that you all heard from the VHO that tobacco sitting for too long is now equated to tobacco smoking. And if you know the devastation of tobacco smoking, trust me, you will not see far too long.
you will always be upstanding and doing something to keep yourself going. So the best small physical activity, and it goes like this. You put the arrow and then you go outside. So look like this. One. That's the devil. That's the devil. Well, if I'm going to count 1 to 10 and 10 to 1, okay, and we all see, because you know that we find something and we speak to point out, okay. So can we start 1, 2, 3, 4, 5, all of us, 7, 8, 9, 10, and 10, 9, 8, 7, 6, 5, 4, 3, and 1, and 1. Now, I will open our legs. You can do this here. Okay, so we just go 1, 2, 3, 4, 5, 6, all of us. 8, 9, 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. You got time. You got time. It's the doctor. Right, so perfect. Looking at fully. Okay, so thank you very much for those round of introductions, Solomon. Thank you so much. And let me thank the various speakers. Fine, they made my way very, very simple and straightforward because they touch on almost everything that I'm expected to speak about. How does it go like this? Okay, great. Right, so I'm scheduled to make a presentation on the CSO perspective on national NCD response, the entry points that we all need to kind of look out for to advance this course. So I'll not deliver the point on this one because I've been already. What's important for me, the fact that NCDs are both causes and consequences of poverty, growing economies of millions of families each year. And that's very important that we must note. The fact that NCD is no respecter of person, it affects every home. And then at the end of it all, what it causes abject poverty, irrespective of how much you have. We must note that. And then there's a need for us to invest more on treating of these diseases rather than preventive measures. And indeed, let me say that it is very, very difficult, for even a donor community to invest into preventive NCDs or preventive measures. Mostly, donors are quick at giving money for policy formulations, and that's the one reason why you have Ghana having many policies. Implementation becomes so much of a challenge because funding, preventive measures like awareness creation is very, very expensive. So not many donors are able to support that. And that's why we are also advocating that possibly the ministry, the government should dedicate funds specifically for our awareness creation. But if you are unable to create awareness, we'll go in cycles. And I'll just put this, it helps me that the Ghana Medical Trust Fund director just stepped out. Hopefully he will return. The point for me is, I believe we all know the Ghana Medical Trust Fund, the Mama Case, which was launched somewhere March this year. No, last year, sorry. The point for me is that it is basically for chronic non-communicable diseases. So at the early stages, then the mama care will come inside. Of course, we have some aspect of the national health insurance that's going to take care of other aspects. But for us as civil society, our core mandate, our core, and I'm happy the non-health sector is here to support the aspect of especially awareness creation, which is very, very crucial in this way. Because if you want to go by the treating method, the firefighting approach, then we'll not go anywhere with this fight. We need to consciously also advance efforts around health promotion. That way, we can give ourselves a target to say, okay, by the next 20 years, we want to reduce the prevalence of, of NCDs by half. If you're able to do that, if you're able to do that declaration, then you have to invest more into our awareness creation. Then our young guys who are coming out will prevent, or will stop, habits that will lead them to get to these chronic conditions. Right, so the silent crisis, a lot has been said already. I will only touch on the aspect of air pollution, which I think gradually is becoming a talk of the moment. And I'm happy that the Ministry of Health have taken it up upon themselves to even beginning to discuss our policy formulation around air pollution. I think that's a very good one. I know EPA does some work already on that. They are here, so hopefully when we go to the session, we would probably have some of them speaking about what they are doing at the institutional level to support, the cause of non-communicable diseases in Ghana. We heard about matters of tobacco use, that is smoking. It has been said all through the presentation. For me, what's important as far as that part is concerned is the fact that the only products that kills its consumers when used as prescribed by the manufacturer kills more than half of its users. Did you get that? The only product that kills more than half of its users when used as prescribed by the manufacturer. So you go to the hospital, the doctor gives you medicine for malaria, but it will rather kill you. It's tobacco. That's the only product in this world as far as we are concerned. So that's the product that we must all know. Unfortunately for us as the world and even in Ghana, we are unable to tackle it, like firmly. Though we have laws that restricts, I say restrict because tobacco has not been banned in Ghana. There's a restriction, there's a law that's, but unfortunately we are still seeing some new and emerging tobacco products, new and emerging ones, and I believe most of you probably have seen it before. The ones that, for instance, the vapes, the e-cigarettes, even watches, can be turned as, cigarettes that people smoke. So technology is advancing, right? AI is advancing. So industry is also advancing. So we need to collectively come together because it's my children, it's your children, my child is your child, right? So we need to be mindful of that. And then also the impact of NCD on the population. So the fact that non-communicable diseases affect the low-level people. Low and developing countries are at a risk, higher risk of NCDs than higher income countries. It doesn't mean they don't get it. It doesn't mean that the junk food are not there. Most of them are actually coming from that place, but they have the system to contain most of these products or most of these diseases where they come. So for instance, when somebody gets cancer today, the country will tell you that sometimes they have to sponsor people for breast surgery because many people are unable to afford it. So you find our disease burden going high, people dying from these chronic diseases, but elsewhere, in fact, it is not an issue when somebody get cancer. This is not a problem when somebody gets, renal failures. It's not an issue because the system is there, to take care of them. So you find somebody who have kidney problems, and it has to go through, as Prof described, your blood system is damaged, so you have to clean your blood system. Here in Ghana, people queue, and I know that I'm sure by now there are a lot of people who have queued at Doc's hospital, both here in Kumasi, just to go for for dialysis, right? But somewhere in America, they have it in their rooms. Somebody he comes and then just go through the system, and then the following day you go to work. So they are normal. So the point is that the burden is so high on us. But the point is that why do we accept anything? And that's what the problem is. We need to be bold enough to say no certain things because most of these things are foreign products that come to our country just to destroy us. Right. So and then it leads to the cycle of poverty, as I mentioned. So if we don't, we're not very careful, go in cycle. And if we are told that the disease keep on rising, it means that we are not doing much. We are not doing much at all when it comes to community. We're not doing much. We need to, strengthen our efforts around that. And then more than 60% of people living in NCD face financial burden. Indeed, we have people living in NCDs who are currently in our midst. If they tell you the amount of money they spend on daily basis, monthly, just for healthcare, you can't imagine. If they're here, so if you are done, you can just speak to them to tell you how much they spend on daily basis to care for some of these things. And that's why we are happy and we thank the president for bringing up the mama cares to take care of some of these chronic conditions, especially people who are unable to access or to be able to fend for themselves when it comes to matters of non-communicable diseases. It leads person, families, and economies to abject poverty. I've mentioned already, and that's something you must know. Anybody who gets, cancer or get a chronic diseases, in fact, it's very, very difficult to go through the system. You can't go to work, productivity will be low, and no private sector will continue to pay you for life if you are sick, you don't come to work. No, they'll lay you off. What happened to your family? Your siblings. So that's where we must be mindful of. Now, so the policies have been mentioned. We have so many policies in Ghana, plenty of them. This is not exhaustive. But only mentioned some, Prof mentioned some, Doctor mentioned some, plenty of them. Like I mentioned, how do we ensure that we are able to implement this into the data? In fact, Ghana will be a very good place in terms of, NCD improvement. Unfortunately, we are unable to implement some of this in the data, but I hope gradually we'll get there. Right, and then challenges and gaps that we have identified, some of them I've mentioned already. So, inadequate domestic funding, I think Dr. Olenu spoke well on that. The point for us here about this part is very, very crucial, and that's why some of these things are very important. Sometimes it's not only about the money, it's about the system that you put in place within your own institutional, places to advance the cause. So, for instance, people come to work, and normally I always want to make example of the banks. Early morning, they have to be at the bank, sort things out. By 8, they start work. They have maybe an hour of break, and it has been sitting down for more, sitting down. So we are developing some mechanism or some document or a report that we can use to aid our banks in Ghana, where we'll have stepwise, approach on how you can still be effective, but not by not sitting down at one place. In my office, for instance, we have elevated, tables where people stand, and I want to begin to see that in many offices. Please, let's do away with these tables. Let's have, some elevated, stands. When you go to WHO meetings, especially in Brussels, for instance, when they go for, when they go for breaks, for instance, that's why I see elevated tables. People stand and work. You have your laptop and you stand and work. Very effective as well. It doesn't make you even sometimes feel dizzy. So let's begin to incorporate some of these things, and we begin to sell those ideas to some of the banks and some institutions in the country, including government sector, because we are all affected one way or the other. So you have the bank sitting down for money, and then when they close, they have to now go and do all the debit and credit and stuff. They get home very late. So why can't the institution have something to even support them? What's at work? So I think that's something that we need to be mindful of. So the issue of inadequate funding is very, very important. We need financial support, to advance the cost of non-communicable in the country because it's very expensive, and the government has opened its arms. And you heard the government medical trust fund say that they are ready to receive support from any context to advance the cost of non-communicable disease in the country because the seed money, the 20% seed money that has been allocated to the national government medical trust fund is wholly inadequate. The 20% from the National Health Insurance, collection, the 2.5% we will pay, is fully inadequate to advance, the objective for that. So we are also urging, I told the minister to make one of the ambassador for the Ghana Medical Trust Fund because I've been promoting it even before it was even launched. The moment it was get, we started promoting it. Right. So the challenges so the issue of a silo way of working, we work in silos too much. We are also a corporate, so that are also part. we don't collaborate in working. So we need collaborative efforts. So here we're talking about multi-sectoral collaboration, and I'm happy that the ministry has a multi-sectoral collaboration with the ministry to advance the cause of NCDs. We need more of that. If the private sector can have their own, non-health sector can also have their own, where they collectively, sit at table to discuss how do we, support interventions around that. And I'm happy to hear, we're happy to hear more from the non-health actors, how they are advancing non-communicable disease within their own institutional level. And then health harming industry interference in public health policy. In fact, that's an area that's also very important because those who produce the harm products, right? I know the harm products, the tobacco, the alcohols, the sugar sweetened beverages, and the UPPs, the ultra processed food. In fact, these are powerful giants, and they would always, in fact, always try to see how they can influence policies to their advantage. And I always say that if you look at the number of people who own those businesses, there are just few people at the expense of millions and trillions of people who are the mercy of their products. So we should be mindful of some of these things so that at least we can, we can also call them to order to some extent, just so not to corrupt their business, but for them to be mindful of how they also do their business so they don't impact too much negatively on us as a people, right? And then inadequate health workers and infrastructure, that's so I think I've mentioned already as a big challenge in Ghana for now. So the trend, these are the trend of non-communicable diseases, and then the NCD called vis-a-vis the health expenditure. So you can see a very wide gap, in terms of non-communicable diseases, which is, very low, throughout the period. So once expenditure, expenditure for the health sector is rising, non-communicable disease remains steadily. So we need to invest. And indeed, let me say that this is not a question only Ghana. Almost everywhere in the world, non-communicable disease investment is very, very low. Very, very low. I'm told that it's just about 2% of global, funds, is dedicated to non-communicable diseases, which is not the best. But communicable disease take a lot of their, and the reasons are very simple, but sometimes we don't believe in that, and we don't want to accept that. The fact that it is easy to treat non-communicable diseases, right? But it's for non-communicable disease, it is very chronic, very, it takes a long time to cure or manage. No, to manage, right? Yeah, because it's very difficult to cure non-communicable diseases. So mostly you manage the diseases, and so that's why it becomes very expensive to deal with. So I will skip this one because a lot has been said already on that. Now, so why non-health actors should act? Now, it will reduce non-communicable disease. NCD reduces the workforce. The workforce. It means that if you don't invest and people get diseases, what will happen is that they don't come to work, productivity will be low. Your best bet will fall ill, and then it's not able to pay. So the early we invest, the better for the us. And then high treatment costs by household, meaning when someone get NCDs, trust me, if your family members all come invest, and then it reduces, your investment in other, very important area of your endeavors within your own catchment area. And then donor fatigue. Donor fatigue is also very important. That's the fact that Britain's donor funding to the health sector fell from 19% to just 2.2%. Very, very, very high, right? And this was declared by our own president in the SONA address that he recently, delivered. So we must also note, so meaning even at the highest level of government, they've identified the fact that NCD is a major challenge, and the gap is so wide. So we need to do a lot more to advance. That. So how non-health actors can act to support this survey? So we need integration, we need collaboration, in NCD, around, all of it, in your budgeting, in your everything. So if you have the non-health sector, please, when you are developing your budget, please, NCD is a cross-cutting matter. It affects every institution. So let's dedicate some budget line, even within our, our own budget for the year, just so we are able to dedicate some aspect of our corporate social responsibility. And then promote healthy workplace policies have been set severally by many of the speakers, which is very, very important for us as the NCD Alliance and civil society. And then design cities have also been said. And then The issues around support school-based programs, I will talk about that in the subsequent one, so I will skip this one too. The last one, which I have mentioned, I just want to reaffirm the fact that invest financially in national initiative, such as the Government Medical Trust Fund, to expand access. So I've mentioned already, and we keep on drumming on that. Let's say, how do we advance or support the Government Medical Trust Fund to work? And then when it works, it helps all of us, right? And then so we continue by saying that we should align corporate social responsibility program, as mentioned earlier. How do we ensure that our corporate social responsibility also have aspect of non-communicable disease within it, so that it's not always about other things, but I mean, and leaving health behind. And then improve data sharing, very, very important as well. So that at least even if we count for data, be able to share, so that we know the prevalence of those also within our health, our workforce sector. And then use media and communication plan to promote accurate information, and then and then to normalize healthy behavior, increase collaboration with government, civil society in the prevention of NCDs. Also very, very important. I mentioned about multi-sectorial, and I think that these have been something we talk about. How do we come together as a unit to advance this cause? So some best practices that I want to mention, WHO spoke about this already. The point is that one of the best way that we can reduce the burden of NCDs. In fact, I have always said, and I continue to maintain, unless I'm challenged one day, that one of the potent medicine, I don't know whether it has a side effects, but please, let me just make sure if I side effects, doctors can tell me. Without any side effects, the most potent medicine without side effects, is this one, physical activity. Because if I have not seen anybody who says that, because I have used physical activity and then the side effects, I've not heard. Maybe you have heard, maybe you should let me know. The point is that, in fact, if you go to the hospital today and you complain of any diseases, when it's NCDs, they will tell you that like be involved in physical activity. I mean, do some form. It is very important, very crucial. Unfortunately, however, I don't know whether it's the devil that is not making us go to more physical, and I think that we need to incorporate that in our work setting now. So this is our office, and this is the outside of the office. I mean, where we create a safe place for our physical activity. So every Thursday, we have a staff of about strength of about 7, right? Including national service personnel. Sometimes we even invite people from the neighborhood, and they join us consistently every Saturday to do physical activity from 4 to 5 or 5 to 6. And within that time, you have us doing it, right? And we also stream on social media for people to see what we're doing. So at least when Dr. Lane was speaking, I was expecting to mention the fact that yes, a classical example is my organization, VAST, and then NCD Alliance. We are hoping that the Ghana Health Service will be able to revamp, their dead tools, so they'll be able to advance it. So these are some of the staff who are also here. Unfortunately, it's dark, so you can't see, but some of the staff are here, and this is what we do every Saturday. So what we are saying that developing actionable work plan policy to promote, and this is something we are developing, which we will use to also sell around to ministry. And we're pitching camp with other institutions. We're pitching camp with other institutions like the Ministry of Health, sometimes FDA, just so we train with them so that we can imbibe that into them. So let's encourage physical, because in fact, it doesn't disappoint. Physical activity never disappoints you. And I tell my staff that what has been keeping me going, apart from God Almighty, the second thing is physical activity. It makes you, healthy. It improves your general well-being, right? Now, and then so this is the inside the building. So sometimes we do it outside, sometimes we do it inside our own building while we train. So active meeting, encouraging walking and talk format, or including short stretches like we do. So please, don't allow yourself to sit in the office for months even without doing anything. Please, it is a disease. And that's where the chronic things set in, because NCD is a chronic disease. With time, you develop it. And then if you want to reverse it, it's very difficult, because you can't stop what you were doing for 20 years. For another 20 years. That's why it become very difficult. So let's encourage this thing, and once we are doing that, we're able to reduce that. Environmental, so promoting the use of stairs, providing showers. If I want to go to the Ministry of Health, I climb. I never use a stair. I climb throughout. And when I go there, I visit many offices. I climb to the chief director's office, to whoever office. I keep on using the staircase. But I have my own colleagues in the ministry who will not use them. Some will say, okay, if I will use them sometime, but many of you find them using the staircase. I mean, well, it's not bad sometimes because of time, but let's try and then use them as much as we can. And then setting up equipment like printers, far away from where you are. So if your printer is in a different room, it helps. So at least you necessarily must get up and go. But these are policies that leadership must put in place so that you are here, but the printer is in a different room. So when you print, you necessarily must go and pick it up. If only you send your subordinate to go for it. So that's very challenging. So we need to, to imbibe all of those, and then away from the decks, encourage the elevate table. I mentioned elevate table. For that, it's very important for an elevated table where we stand and then work. It's also very effective for all of us, right? And then now school-based healthy eating. Some schools in Ghana, have banned, UPPs. And indeed, we are documenting some of the schools in Ghana that have banned, the bringing of UPPs. When I say people, ultra-processed products. In fact, there's some call it ultra-processed food. But bro, I think that we have to use products because this thing, they are not, it's not food, they are products. And so we have to begin to, but some use products, some use food. But we want to maintain ultra-processed products because they don't mean any good, for us as people, right? And many other across. So Brazil has one of the best example of how they are, they incorporate work and school feeding and stuff, right? So this is a classical example of a meal in Brazil. They would also have one of their best, school feeding. So you have everything. So you have beans, you have rice, you have vegetable. I don't know what is one, but it could be something beans, or something. So this is a classical, menu for advocate. But in our case, it isn't like that. We need to improve. If we can have 4 sets, sometimes I know it's expensive, but let's see how we can improve upon that. As we know, the chef is here from the Ghana Education Service, so hopefully they will transmit this to the leadership. And then workplace healthy eating. I have highlighted the Ministry of Health here because I've been to their canteens several times, and I say that they are doing very well with their canteen. I don't know how many people eat there too, because I have been to their canteen to go and eat, and I see people bring junk food to come and sit there and eat, right? But they have one that fight for morning. They prepare the omotos, the fufu, the local food. So I see that a lot, which is commendable. And I think if we're able to do that in many of our institutions, it helps. Rather than the wayside food that we normally will buy, which we have no idea where it's coming from and how it is being prepared. Right? We are not trying to cross somebody's business, but we should be mindful of some of these things. And then also workplace physical activity. I mentioned Vast Ghana, the WHO also have something like that. I'm not sure. The WHO do have something like that. Yeah, they also have something like that in their premises. The WHO Global also have something like that. We need to advance. Ghana House I mentioned. I didn't know that it has collapsed. I have to delete from there. Can you help me take it out? Okay, but the point is that we need to revamp it. I don't know why it didn't collapse. I don't know why it will collapse. The Ministry of Health, I didn't bring them here because I know there's a structure. But the point is that it is very, very inactive because nobody uses it. WHO, are you there? WHO, are you there? Yes. Sorry. I mean MOH. I meant MOH. The structure is there. It's a very big one, very beautiful one. We have pitched camp with MOH before to do activity with them. Even that one, we have only few people coming, right? So the point is that MOH need to walk the talk, lead. So only we all follow. Because if you are the mother and you don't lead, people are unable to follow, right? So when MOH come and say let's do physical activity, but we are not seeing them driving the city, it becomes challenging. So we need to put them, and that's why we went there to see how we can ignite that. But I think we were there about last year, right? Last 2 years. Since then, we've not been there, but I'm also told that it has still not been active. So please, we need to revive that, right? And then sport-based healthy environment, not encouraging at all. Dr. Lane said that when he was in school, there was physical activity that we're doing. Now we don't do it. We need to improve that. And then support health facility promoting healthiness, also not encouraging because we don't know, please, if EcoBank is here, if EPA is here, if local government they are here, mental health, please, if you have such facilities, please, when we get to the moderation, please just let us know so we know what you're also doing in your environment. So at least it's helped all of us to promote. Well, otherwise we continue to say that we are not doing well in these areas. Now, right. So I will end my submission with a quote. One of the favorite quotes that I love so much. I think it has been said by everyone. So I just want to sum up what various speakers have said with respect to this. It says that tackling NCDs and their main risk factors. And the main risk factors: tobacco, alcohol, sugar sweetened beverages, physical inactivity, unhealthy diets, requires the whole of government or every government, every sector of the economy is very important that we come together on this. And it says that and the whole of society approach, that everybody, me and you, civil society, private sector, we must all come on board. And whole of UN system to work together. Because you see, that's the reason why for me, I was happy when eventually we have political declarations, because the moment we become a political declaration at the UN level, then become a political, tool for use. And I'm happy that at least in Ghana, across the globe, our heads of states, from the beginning to now, have been championing or have been elevated as one of the champions for NCDs across, across the globe. And currently, our president is doing so well, even at a global level, and speaking about NCDs. So the point is that at the UN level, they say that we must all work together as one, if we want to defeat non-communicable diseases. But if we work in silos, the industry or people who don't want us to thrive in health will continue to have their way and be taking millions of dollars and Ghana cedis from all of us. So this was said by Dr. Nick as the advisor to the WHO. Is it still there? The WHO is now. Right, so I'm ending by saying time to lead is now. A healthier Ghana is a stronger Ghana. You agree, right? A healthier Ghana is a stronger Ghana. And civil society and partner, we offer expertise. That's what we do. And the policy, every policy matters. Every sectorial decision is ultimately a health decision. A unified effort is required to address the NCD crisis and build a healthier, more resilient nation for all of us, Ghanaians, and even beyond. Thank you very much for attention.
Can we do it better for him once again? Thank you very much, Mr. Abraham Masaoud Musa. We affectionately call him Alaj, even though he's not going to Hajj before.
But this year, I will prepare all of going to Hajj. Abraham, I hope you heard me. We'll talk about that next. So we got into an important aspect of the event. Communication is incomplete when the talking is being done by only one face or one aspect. So we want to elicit our team, creating commitment and elicit collaboration to reduce the rising activity. It's a collaborative effort. Alright, so I'm just saying the briefing. I wouldn't be the one to lead this session. I told my boss, Abraham, St. Joseph from Dr. Joseph from MOH, who will be leading this session. So this is the time. Just open our share. We want to have more ideas. We can't do it alone. We need everybody on board. Just as he mentioned in his last slide, a whole of government and a whole of society approach is what can drive this agenda forward. So, Mr. Abraham, Mr. Joseph, if you are here, I will kindly ask you to move forward here. We have 2 microphones so that we start the conversation. Thank you very much. Let's welcome Pastor Thomas to lead us.
Thank you very much, Mr. MC, for that introduction. So, like you rightly said, at this point, we want to open up conversations. So, the idea for this particular session is to create some kind of commitment for all the state actors that are represented here in this meeting. We have heard a lot from the earlier presenters, and if I look at the theme for this session, it says, how can the non-state health sector use their platform to prioritize and invest in NCD prevention and control? We have not heard anything at all. At least so far, we've heard about strategies that we could use to prevent NCDs and to control NCDs in Ghana. I think one of the key messages for me is that the cost of doing nothing is higher. The cost of doing nothing is higher. Each of us from the various institutions have platforms, and so we need to begin to think about how we can leverage these platforms to prevent and control NCDs. This is how we are going to go about it. I don't know how much time, but I am thinking that at least people should now begin to reflect on what we heard from the morning. What actually hits you? What is surprising? What did you know before? What have you learned? I think it's an icebreaker, right? So we can take a few reflections on what we have heard so far. Who's ready to go again?
Sometimes we need to rest concerning the human papillomavirus, the cervical cancer. Because I know the very clearly. The woman has cervical cancer. It's like a person gets, right? But they still have sexual so they said, is this communicable or not communicable? Can the woman get it from the woman? There is communicable. If not communicable. I think that we're going to relax.
I think we'll take more reflections. Anything that's surprising.
Thank you very much. So I really learned a lot. I'm Dora Piazza from National Road Safety. I can say the session was very eye-opening in the sense that when we are doing our activities, I was able to link. I can see that most of our race actors in this safety and NCDs in relation to alcohol use. When the driver takes alcohol, it becomes impairs. And Lord, this was behaviors and speaking overtaking parents. So what I'm taking from this is that when I go back, we'll have to restructure our business so that we will embed with the NCDs, necessities like taking of alcohol, the food that the hypertension can cause accident. So we have to link this when we are presenting our business. And I also realized that we've not connected those safety with mental health. So when I go back, we'll do that. Thank you.
This is really very insightful. So we already seen the importance of looking at the way our messaging is crafted. And from this meeting, what she's saying is that they have to look at their messaging again and then explore other collaborations with other institutions. And you have been able to identify the mental health authority as one of the key institutions that we have to collaborate with. Yes.
Right, so since we also have made research, so let's assume contact, amongst the experts in the international to help designers of this my name is
Please use the microphone so we can hear.
So, my name is Akuni from Ghana. Because I was saying a lot of things said.
I personally don't hear anything on spine related disease or condition. I don't know whether that is not part of NCDs, but as I stand here, I've gone through spine surgery. It's about 3 years now, and this condition, to some extent, is really rising. And it's we need to look at it. Long sitting and so on and so on. These things, this preventive education, whatever, on sitting and whatever. So let's take note on that. And see, I did not go through any accident, but just started, and I have to go to the surgery. And I'm really going through the post-surgery in terms of managing and health costs and so on and so forth. So I think we have to look at that part. Then my second issue has to do with data. We need to know which of the NSCs, which of the NCDs is going up, coming down, or whatever. And then maybe the years, and so that at least it can be properly and managed based on evidence and based on facts. So where there are gaps, I think that statistical service will also be of some, and over the years, working with the Ministry of Health and Government Service in terms of strengthening and putting data of helping to find addressing health issues. So that collaboration we should be harnessed so that we can really fight or address these issues based on it. Thank you. So we'll pick two more reflections, then we move into the other section. We can pick one from there.
Right. Okay.
Please, your name and where you come.
So I live with them. Basically, your immune system fighting which can affect any organ in your system, your brain, your kidneys, your lungs. And so I think it's something that we also go to look at when we are talking about various diseases.
So we take the last question.
Thank you very much. Good afternoon. My name is Isi Bonomoki. I work with the Environmental Health and Sanitation Directorate of the Ministry of Environment, Chief and Religious Affairs. Throughout the morning and the afternoon, it's really been, for me, it's been insightful. Reason being that, as I said, I work with environmental health and sanitation. And I was just asking myself whether the name is or non-communicable diseases are representing or kind of a synonym to what we do. Looking at our scope of work, it's more about identifying social, physical, environmental, the chemical pollutions within the environment that have some impact or that have an impact on the health of the people that we serve. And the ultimate aim is to prevent. It's about prevention, solely about prevention. So if NCDs are aimed at preventing these diseases, or if NCDs are the non-communicable ones and the objective is to prevent them, That is where I see ourselves as being strong allies to the prevention of the non-communicable diseases. If we take the structure that we have at the national level right down to the community level, it's just similar to the Ghana Health Service or the Ministry of Health Ghana Health Service structure, where we have from the national level to the community level. And I see that there are opportunities for us to have stronger collaboration, stronger relationships to be able to advance the cause of NCDs prevention. Thank you very much.
Thank you so much. We're delving into reflections on what we have heard so far, but I think that the last speaker has started the conversation around what they do and how they can collaborate with that institution. But before we move on into that, there were a few questions that I feel the experts must respond to, so we give opportunity to both topic to respond to those issues that we consider.
So, I think the big is remember when I said there are many, and I said I was going to give you cost control. And some of them you need to give the cost. But there are so many. So it's better than possible. That you acknowledge autoimmune conditions, and actually, if you look at one of the slides, type 1 diabetes in young people, a lot of it comes from autoimmune. Okay, so those autoimmune things are there. But then the very important one I didn't mention about sickle cell disease. Sickle cell is also a lot of so there are many. Then the spine, the same thing. But if you actually stretch it out and you look at the common cause of back pain is one of the very common causes. It will not kill you, but it creates a lot of disability. And a lot of the issues will come from degenerative disorders. Degeneration is that only after 45, you see that your bones start degenerating. And it will happen to everybody. The only difference is that it's not different kinds of ability. Some people need to just get around. Then the other thing has to do with sitting. Posture. Like you sit in the office and then you don't sit well. All habits, that can also be a problem. I think you did mention it, that it's one of the concepts that I really like. The standing table. That's not when you go to the office, they have a standing table. They have a table to sit on. When they get tired, you raise it like that and then you work stand the best. So that helps also with the posture. Then there is the somebody mentioned something about cervical cancer. And so I think let me take a step back so that we don't confuse things. Cervical cancer cannot be transmitted from one person to another. It is about non-communicable disease. Get that one, understand that. Cervical cancer cannot be transmitted. So if I have a woman that has a cervical cancer, I have another cervical cancer. What I said, there are few cancers that the origin of causing the cancer is infectious in nature. So the virus that causes the cancer, that is human papillomavirus, is a virus. But when you get the cancer, you cannot transmit the cancer from one person to the other. I hope that is clear. Now, if you have the beauty about cervical cancer is that the treatment is so easy. It's so easy when you screen, you can use it's like you freeze the cells around the area and then just take it off. Or sometimes it's almost like I don't know, cauterization is like a hotline. And then I'm not story. So it's very, very, very. So when it's not that data, you see that the incidence is high, but survival is very good. I hope that's clear. And there are actually a few diseases that are not communicable, but the origin is communicable. I mentioned the liver cancer, hepatitis B, is an infectious disease.
But when it comes to the cancer, you cannot see the cancer from one person. I hope that is clear. Thank you.
I think it deserves a round of applause. You have a follow up? You have a question for him? Okay.
It's actually on the decision of diabetes. So that was actually what you said, that it is non-modifiable. And I'm asking because if it's in pregnancy, during pregnancy, you are giving some prophylactic medications to be able to prevent other diseases and infections. So why don't we have something that's it's why don't we have something for the gestational diabetes? Because of the presentation, I realized that the babies that weigh or the fetuses that weigh about 4.5 kgs. So, is there nothing that the mothers can do to ensure that they don't get that weight that would predispose them to the gestational diabetes? Thank you.
Yes, very good point. So what you are describing is like the chicken and the egg. The baby become big because they have too much sugar. You understand? If there's too much sugar, that makes the baby grow very fast. So the key, and they actually almost facilities, if you are pregnant, they have to screen you for diabetes. It's the standard. You have to screen for diabetes. You have to screen for hypertension. Because, and I'm sure we have mentioned this, that a lot of women have gotten hypertension just from their pregnancy alone. Until the baby comes out, the baby will go down. You understand? So you have to screen. So immediately you screen and you see that this is a high risk person, then you can start taking action. The same thing with hypertension. So I think the screening when the person is pregnant is critical because let's say when you come to the fortunately Ghana now people are coming to the antenatal clinic within the first 3 months. Usually Ghana will start going after 4 months. Now they are coming in. So when they come early like that, you screen and you find that it's easier to start managing that rather than they come in 6 months. 6 months already, they're giving the baby too much sugar. And then the baby is already too big. And then they have to actually do something because you can't just deliver such a big baby. Or I hope that's clear.
Yes, so let's shift gear now to discuss from your institutions how you think we can integrate NCD prevention in your policies, your programs, your projects. So you let us know from everything you have heard so far, what do you think you can do at your various institutions to integrate NCD prevention and control as part of your programming? Maybe for policies, there is an intended review of your policy or your sector policy. How do you think we can integrate issues around NCD prevention in that review process? If there are programs, how can we do that? So please let us know where you are coming from, and then you can speak. Let me go here and come.
Labram already mentioned school health education program, and that is why I'm making this comment. Outside, if you don't join us, you won't know the efforts that we are putting in. We have a nutrition friendly school initiative with Ghana Health Service, and under this, the schools develop their own policies. And one of the things that they need to consider in that policy is the kind of food that is accepted on the school compound. So when they develop this policy, we bring the food vendors also together with PTAs, and then we discuss what should be sold on the school compound and what not, they are not supposed to sell on the school compound. And this is working perfectly for all the schools under the Nutrition Friendly School Initiative. It demands some resources for you to be able to do that. So currently, we have about 600 schools that are on board, and every year we add on. Aside the Nutrition Friendly School Initiative, we have also introduced school gardens. And the school gardens, the schools are feeding from what they are planting. But there's one particular garden that is coming from SHEP as our own initiative, and that is potato planting. I started planting potato because I used to read a lot and I stopped reading. So I turned my compound into molds and I have 100 on my compound. So I noticed that throughout the year, I don't spend money reading again, but I am getting food throughout the year. Every 4 months is ready for harvesting. So I introduced in 2 schools in Eastern region. Then after 1 month, we introduced another 20, which were picking the stems from the 2 schools we started with. Fortunately, we got one farmer to also join and we picked some stems from there. We now have the support of the University of Environment under climate change, and they are also supporting 30 schools. So gradually we will be adding on. And the 21 schools that started at first, they have incorporated this into their school feeding program. Free, when they harvest, that is what they eat. So if we can scale up to all the regions, then gradually we will be getting rid of all these funny foods, the ultra processed products that we have, the schools will not sell. But there is another thing that I need Lebron to join us to do. The private schools are not under Ghana Education Service, and so we do not have full control over the private schools. And if you notice, it is in these schools that you find the sale of these items within the school. And because we do not have the full control, it is difficult to talk about it. I think in your meetings, you always leave them out. There are associations, they have several associations. So if you invite one, you think that will work. Invite all the associations. They have the Owners Association and then they have the National Private Schools Association. So if you invite the two, because on the Ghana National Association, it is not the owners who are on that platform, but on the Owners Association, it is my school. And so if you tell me this is not good, they are doing business, but they need to understand some of these things so that they can implement them fully. Thank you.
Thank you so much, Madam, for that. On the point you landed, yes, they are not under Ghana Education Service, but they should be under some level of regulatory authority. So can we go through their regulators? I mean, it's not by compulsion, but we are talking about collaboration.
Yeah, we are all under the Ministry of Education, but they are falling under NACA. So they are now regulating them, and because of that, we need to bring all of them on board to collaborate when it comes to some of these things.
Thank you so much. On a lighter note, I was in a meeting and a rep from your institution made us understand that the students are stealing. The students are stealing the potatoes. That's on a lighter note. Yes, my brother.
Okay, so my name is Derek from Ministry of Youth Development and Empowerment. So it's just this morning that I realized that most of the things we are doing as a ministry is in line with this morning's discussion. As a ministry, we came into existence last year, and one of our focus areas is youth health and well-being. And so to have evidence-based policy making or decisions, we decided to embark on a study. And one of the studies we did was on alcohol and substance abuse among Ghanaian youth in tertiary and secondary schools. And the findings are really alarming because in the tertiary schools, as high as 41% of students believe that drugs are available and they are being used in our tertiary institutions. And so we thought that this was so alarming, and we've already started engagement with narcotic, mental health, and other institutions, including your institution as well. So I believe that the engagement has already started with our part. And we also strongly believe that the youth forming a major component of our population, there's a need and we have a role to play as a ministry. So we have already started, and I just wanted to share that with you.
And I think that's a very useful information on what you are doing at your
Yes,
ministry.
and then one other thing. So we also had, as part of our study, we have the obesity, that of road accidents and all of that. And so the statistics are there, and we can share them with you.
Great. We'll be looking forward to that. Can we go to the back? Pick a comment there, and then I'll come back to you. Please, your name and the institution.
Thank you. Good afternoon. My name is Christopher Agbaga. I'm with the Ghana NCD Alliance. I'm an advocate and a peer trainer for the Ghana and Global NCD Alliance. Two things. One, I want to talk on or touch on mental health. I don't know if it is safe to say, but I don't think we are doing justice to mental health of not only persons living with the conditions, but their caregivers as well. The recovery and management process of persons living with NCDs depends heavily on mental health. I'm even surprised I'm saying this now. Back in the days, I wasn't so keen on mental health when it comes to training. I'll talk about diabetes, I'll talk about, the cancers and all of that. But in recent times, when going to the hospital becomes more frequent than it used to, when finances get depleted, they're more and more. And when you begin to, when the social life begins to change rapidly, that you don't even have a hold of what is going on, then you'd realize that the mental health of that person is key to the recovery and management of that. So, what are we looking at as a unit? Are we looking at collaboration, even with support groups, to ensure that persons living with NCDs have some sort of direct access to mental health consultants or therapists, and that they don't necessarily have to go through certain channels, as sometimes it deters them from then wanting to go for their services because of the tedious nature it presents itself sometimes. Unfortunately, too, I don't know if the mental health authority want to take this up. Some of the professionals in the space makes it a bit unwelcoming
In terms of attitude.
in terms of attitude. I have had to speak to a few of them. This January, like this, I was in a hospital. I'll mention the name. I was asked to go and see the psychologist of the hospital. Honestly, I don't know if I was the one counseling him or he was counseling me, because the session was a bit odd. You could tell he was exhausted. I don't know if it is by the day. You could tell he was sleepy. But for me, I've lost an advocate in Kenya to suicide, and it affected the advocates community because this was a powerful voice who was speaking against the criminalization of suicide. And when the law had passed decriminalizing it in her country, then she rather falls victim to what she has been speaking against for the last 10, 15 years. So for me, mental health is important. How are we building collaboration? How are we ensuring that persons with the condition are protected when they are even going for mental health services? And then also to touch on what was raised earlier, the lesser known NCDs, it is time that we started highlighting them. Most of the time, when you look at even funding opportunities, they are mostly channeled towards the well-known NCDs. If it's not stroke, if it's not cancer, if it's not diabetes, if it's not hypertension, then you can hardly have support for persons with even autoimmune conditions or other types of conditions that are quote and unquote lesser known NCDs. I train persons with advocates across the globe. And sometimes when they are speaking about their conditions, you can tell that even the number of persons with that condition and that training is just one or two. The rest is diabetes, the rest is hypertension, the rest are the well known NCD conditions. It is high time we started throwing more light to conditions that are lesser known within the community. Thank you.
Thank you so much. You raised an important issue around mental health, and more specifically, the mental health of people that are living with non-communicable diseases. There's a rep for mental health here. I'll give you an opportunity to say a bit about what you are doing in this area. And please, if you have the opportunity to speak, I'll make the suggestion that you keep it succinct so that we can give others an opportunity to also
contribute to the discussion. Please go ahead.
Thank you very
I'll come back
much.
to you.
So, on mental health, persons with mental illnesses and communicable diseases, and their caregivers. Actually, I apologize for what we experienced at that hospital, the hospital that you don't want to mention in the name. But we have identified that. You see, working at the mental health space, is quite stressing, a very stressful situation. The logistics, even the condition that you are managing itself is stressful. So that was identified. So last week, we started distressing our staff. So we had staff retreat as a pilot. So we are trying that because we realize that you can't give what you don't have. We have to be mentally healthy and good to give out that to others. So we have started. So we acknowledge that and we are working on it. And we know that most of the conditions and the medicines that are prescribed push our clients to non-communicable diseases like diabetes and hypertension. So physical activities is part of the care that we provide. So we encourage them to do physical activities and the regular screening. Because when they are on the medication for some time, you have to screen them to know how the chemicals in the system are going so that either you increase or you reduce. So we are working on it, and we acknowledge that the caregivers to who non-health actor caregivers, they are also going through a lot of challenges. One of the gaps that we identify is psychosocial rehabilitation. We are working on that too. So in due time, we work together, and nothing will be done without you. So we'll work together, and then we start tackling the challenges one after the other. Thank you.
So thank you, madam, for that response. Thank you very much. And I think the last issue you raised about the lesser known NCDs, the issue about data has come up in this conversation. And in a very much resource constrained environment, we look at what the data is saying. And we've looked at the burden of NCDs in Ghana. And we saw those that are at the top. So I agree with you that we need to begin to start paying attention to some of these lesser known, I don't know whether it's in the literature, lesser known NCDs, Prof is here. But at the end of the day, it's about resources. So we need to allow the data guide our decisions as to where we spend our very limited resources. And so the hypertensions, the strokes, the cardiovascular diseases, as has been said, are really at the top. But we can have conversations about it. Yes. And I'm going to move from this wing. So I'll come to this wing. And then if you are a media rep, please hold yourself in readiness. You have to tell us what you are doing in the media space. Yes, go ahead.
Yes, my name is Akolbida Hashim from Ministry of Sports and Recreation.
Yes, sports.
Today, I'm so happy today that most of the presentation they've done, we've as a ministry, there are some initiatives that we've already embarked or we are embarking to prevent NCD.
Okay.
And I'm so very happy on that. So I want to highlight some of the key initiatives that Ministry of Sports and Recreation is doing, to advance NCD. So the ministry is already collaborating in multi-sectoral initiatives, such as the WHO IOC Community Sports and Health Cooperation Initiative, to deliver community sports program that boosts physical activity and target over 1 million people by 2025.
By 2025?
Yes, please.
To target 1 million people?
Sorry, by 2026, sorry. And then, we've already supported the NCD strategy 2022-2026, that strategy. The ministry is already supporting that by promoting mass participation in sports, and this in the long run can, help prevent NCD. And we have a new program that the ministry we've already initiated. It's a new flagship program called the National Recreation and Wellness Program. This program fosters like lifestyle, prevent health and community wellness. And this one, if you're exercising at sports, at the end of the day, it helps prevent NCDs. So our ministry is already embarking on some key initiatives like this to prevent NCD. And I hope by the end of the program, when I go back there, we will initiate more programs in relation to this program. That will help us in the long run and help the nation fight NCD. Thank you very much.
So I like how he actually landed. And anyone who speaks can also give us an indication as to some commitments that you can make from this meeting, because we need that and we'll follow up on that. Yes, I spoke to Nane Kuya earlier, so I remember your name. Please go ahead.
Thank you. So just as my name has been mentioned, I'm from the Private Health Facility Association of Ghana. So we are already in the health business and we know what is happening around. And I want to pass a comment or maybe a suggestion to NCE programs, especially on the girl child. I agree with my sister that no girl child is supposed to go into pain. You get it? When a girl child is having its normal menstruation, the kind of things that come. Because I remember when I got there, mine didn't come for 6 months. And my mother didn't know where to take me. And I was always in pain. When the month is ending, my palm will be red, my legs will be red, I can't walk, and I need help, but there was no solution. So we need to have something, maybe a girls' corner program, not only coming from the foundations, so that it will be easy for the girl child to be able to approach when they are going through this kind of challenges. That is one. My last one is with the mental health. Recently, something happened to me over the weekend, and I realized that I really need help. I'm running businesses, I'm running other things. I'm a low BP patient by this. But I realized my head was aching out of the blue and it was becoming rampant. I checked my BP and my diastolic was around 95, 98. I realized, hey, I'm dying. I was seeing stars. I quickly rushed to my facility for help. You can imagine if it is an ordinary person, where is that person running to? Who is the person going to talk to? That this is what I'm feeling. Even we, the health workers or the normal workers who are giving the solution to the people, are we mentally stable? It's about time we need to look at all those things so that if you are running some program, even for those of us giving the service to the general public, to also be mentally sound. If I'm bashing in the house with my family and you ask me to come and talk to a patient, I'll say, okay, Mate, okay, go and do exercise, go and do this. I won't even follow up because I have my own mangana carrying my head. So we also need to look at all those areas. Thank you.
Thank you very much. By way of information, I think the Ghana Health Service does have the adolescent corners at the facilities. We can talk about the functionality of that, but it's nationwide. Because you asked the question.
Yes, I know. Concerning adolescent corner, I've even started one in my facility in Boko. Do you get it? It's working. But normally, the children also feel reluctant to approach, depending on the kind of person. Because if his mother's friend is the one sitting there, and I come and tell my mother's friend I want to have an abortion, by the time I will get home, the story is already in the house waiting for me. So they need someone they can easily communicate with, their age mates. Thank you.
All right. So I'm moving to this wing.
Second,
Is there a media person here? Because we want to hear from the media.
The media person is on this lane.
Okay.
All right.
Then we move here. So I'll come to you.
Okay.
So my name is Diana Soa from the Ghana Broadcasting Corporation. For me, I think that one thing that hit me was the fact that I've never really thought that the use of tobacco could be related to sedentary lifestyle, like sitting for so long. Something we do all the time as journalists, sit behind the computer from 8 to 5, sometimes beyond that. We hardly get up to do anything because you are so engaged getting your stories ready. So I think that it's something I have learned today, something new, very important.
Great.
And for GBC, I think we have the platform to educate, create awareness on some of these things. We have the adult education in all the local languages. And so I think that the platform is there. We do a lot of partnership with the Ministry of Health, the Ghana Health Service, NCD Alliance. I think that we still have, our doors are still opened. And so, especially on days, let's say the World Diabetes, World Kidney Days, and all that, we do a lot of awareness creation on our breakfast show. On almost all our programs, we have a lot of segments, our news coverage. So I think we are doing a lot already, and we are still open for partnership and collaboration in these areas. Thank you.
Thank you so much. I love the fact that you are still open for more partnerships and collaboration. So if you are here, GBC can give you some free airtime to educate and create awareness. Amazing. Yes. Yes, sir.
Thank you. My name is Cecil Francis Kujo. I'm with the NCD Alliance and also with Generational Growth Foundation. I stand here today, I say thanks to what actors of the non-health actors in the healthcare business. Why do I say so? If you all look at this booklet that has been given to everybody, yeah, the picture down here, the down picture, the male that you see standing there, that old man is me 4 years ago here in this room. That was when I lost all hopes. When all the hospitals, the medications have been taken, and it's like I was on a suicidal mission because one, nobody to talk to, as Nanama said. I need help, but who do I talk to? So the only thing was for me to just get everything off because I knew it's like there was no hope for me. I was hopeless. I wanted just end it all and go. I finished university fresh, and before I had diabetes. I did not know anything about diabetes, and it's like wherever I go, from one calamity to the other, I lost weight from 180 kg to 54 within 6 months, and all the stigma. I passed through all that until this lady here, Tina, met me, invited me to this program. I came here and I got to know that I also have a voice. At least there's somebody who wants to listen to me. There is hope for me. All is not lost. The hospital could not give me that. The hospital could not give me that. The medications that I was taking were rather making it worse for me because anytime I take metformin, my system reacts. And vomiting, I could be here and you see me just hearing center, start vomiting, reacting, and all those things. But thanks to CSOs and others, they made me feel there's life for me, and I'm alive today. Though I'm still facing complications and all those things. But I have seen the effect of non-health actors because the hospitals were not helping me. I went to hospital for over 6 months. They could not diagnose what was wrong with me. So all those things were there. But thanks to actors like the NCD Alliance, the other people there, they made me find my voice. And because of that, I got to know, and I have devoted my life, and I'm always grateful to NCD Alliance, and I've devoted my life to push for education
prevention. Because if like I knew something about diabetes and all these things, I don't think the situation that I got to where I was ready to take my life, I would have gotten there. I don't think I would have gotten there. So I came out with, I've been developing concept and pushing, doing whatever I can, wherever I can to educate people on prevention, on non-communicable diseases. Because when you get it, it's only your property, it's in your pocket. You can't share it with anybody. And nobody who feels it knows it. Nobody feels it like you feel it. So nobody knows what you are passing through. It's only you who are feeling it. So I have seen the goodness of what we are supposed to do. And I have devoted myself of pushing for education. So I have come out with a concept currently that I'm working on. That's the YAS, Youth Ambassadors for Sustainable Development. So that whatever we are talking about, this prevention and also educating people on the health and all, so we can get it to the student. We are here, we are spent forces. We've already grown our cultures and things, and it's difficult to transform us. But I think if we push this education to the younger generation, to the younger ones who are coming through our education system, through the school system. I contacted Chef some years ago, but I'm still going back to them again to talk, and to the Ministry of Education, so that we can let them grow with it. We were talking of, I asked somebody, do you know tomatoes? They've not seen tomatoes leave. They know the tomatoes raw fruit, but they've not seen tomatoes grow before. They are in Accra. They are in school gardening, feeding ourselves well, stopping the fertilizer fed and all those chemical feed and all those. We need to change from that. We need to let our children start doing small planting and things in our homes.
Yes.
So that we can feed ourselves, our environment. We need to take charge of our environment. Our students need to spearhead the environment with the local authorities.
Yes.
So that they together they can call their father. If their father throw rubbish, they'll tell you, you are littering, so don't litter. So we need to all push and educate people on that.
Nothing sponsors advocacy than
Those got me short too, but I'll still look for a way to fish it in another time.
I like the passion. Thank you so much. I'll pick two more comments from this side, if there is any. Then we can close out on this session.
Thank you.
Yes.
Because he mentioned environment, so I want to pick.
Oh, so if you hadn't mentioned environment,
I won't miss it. So we are coming from Environmental Protection Authority, EPA. So I'll just talk about two things in the area of noise pollution. Because this diabetes, this hypertension can be caused by higher doses of noise. Research has proved it. And hearing impairments and all those other sicknesses that are not communicable. So EPA, we do what we call noise monitoring in collaboration with the assembly. So if you are in an area where the noise level is beyond, because you can't even sleep because somebody wants to operate certain things which is affecting you, you need to lodge a complaint to the nearest district assembly or the nearest EPA office. Monitoring will be done, investigation will be conducted, and it will be regulated for you to have a sound environment to live in, so that some of these non-communicable diseases can be also reduced. And also in the area of air quality, when these pollutants are released, that's where the free radicals get into our systems and cause a lot of instability in our system and causes these NCDs. So we have monitoring stations all over in some communities and some regions as well. So we want to know the quality of the air that you are breathing in that particular setting on real-time basis. That means at any time, we can know what is the air quality of East Legon. So that maybe, you see, we want to get to a time that you can decide that today I won't sleep at East Legon because the air quality level at East Legon is not good at all. Because when I sleep there the whole night, I'm going to take in this dose. So therefore, I'm going to sleep as maybe airports, or I'm going to sleep at Nima, so that you can change your environment at any time. So we mounted this, and when you check our Facebook, our social media handles, Facebook, Instagram, and on daily basis, you can see some of these
readings and measurements that can assist you and advise you. Gone are the days when during October, November, December, Harmattan time, we all say it's Harmattan. But we've seen that it's not normal Harmattan. It's pollution loads that has gotten to some level that at times we say it's Harmattan, so that we can avoid some of these things by taking the right measures. I won't talk much. Thank you.
Thank you so much. Thank you. So I think that it's a good time to bring this session to a close. I know that we can never spend only 1 hour discussing an important issue like this. But I want to thank you all for your contributions. If for nothing at all, let us all remember that there are several determinants of health. And some of these determinants do not rest just with the Ministry of Health. And so all institutions, all sectors remain very important to ensure that everybody is healthy. Ghanaians are healthy. And I think in one of the presentations, we highlighted the importance of the health in all policy approach. What it means is that at your various institutions, you need to ensure that whatever policy you are developing is fortified. Fortification means that you are asking yourself whether the formulation of this policy will be harmful or injurious to health. Once you identify anything in that policy that will harm health, we are asking that you become advocates and fortify that thing before that policy is finalized, so that once it comes out, it doesn't harm you or I, because you don't know where you find yourself tomorrow. I thank you for the opportunity, and I hope we'll meet some other time to have more discussions on it. Thank you so much.
Please, can we do it better for the man? All right, thank you very much once again for that session. We've got into almost the climax of the meeting. I would want to once again at this moment invite my boss, Labra Masaudu Musa, to give us a brief closing remarks. And if possible, we also have a rep from the MOH to do same as well. We started together with the opening remarks. Collaboratively, we want to do same for the closing remarks. So, Mr. Musa, I don't know who. Okay, so after Mr. Musa, then we'll have a session from the MOH briefly.
Right, so let me first and foremost thank everyone for waiting patiently as we embark on this journey together from morning to this time. And to say that the Ghana NCD Alliance, or the NCD Alliance Ghana, we've been doing this work for over, since 2017, and continue to advance efforts to support the Ministry of Health, the government, to advance NCDs in Ghana and even beyond. Right, so as a way of follow-ups, what I want to say in that is that we will be doing some follow-ups with almost all the non-health sector that is present here today, and then also ensure that in our subsequent meetings, right, so we will be reaching out, as I mentioned, and then also ensure that going forward, we would, as much as we can, involve the non-health actors in all our programs. I know the Ministry of Health every year organizes the National Health Forum or summit, and I want to believe that they've taken notes of the concerns, the commitments, and then what the various sectors are doing in their respective places to advance the cause of non-communicable diseases. Let me also mention the fact that as we live here, I was having a chat with one of the participants at the back there, and I mean, we've heard from many of you already your commitment and what you intend to do when you go back to your respective places. In fact, we don't take this your attendance here for granted. We are hoping that when you go back, you meet with Ali with your senior most persons, if you are not a senior most person who attended this meeting, to have a very deliberate discussions with them. Possibly, we are available together with the Ministry of Health to come over to your institution to see how we can strengthen collaboration between your entity and the Ministry of Health or the NCDs Ghana, so that we can all advance the cause of NCDs in Ghana. Now, having said that, I would want to thank each and every one of us who have come here today. Right, so as I mentioned, we will reach out as much as we can as a way of follow up, so that we can continue with this engagement. And from the way the discussion was ongoing, I want to believe that participants here have actually benefited extremely to what we discussed here today. Right, so right, and then finally, let me say that the institutions that are present here, we would, as much as we can, use you as the focal person or the lead in your various institutions, probably as a means to get to your leadership in the event of, I mean, anything that we think is very crucial for this work that we have jointly agreed to do together. On that note, I would want to once again say thank you to all of you for coming. And I think our co-organizers would also do their final remark, then we will leave here. Thank you.
Good afternoon, everyone. My name is Lucas Anan. I'm the head of Intersectoral Collaboration Unit at the Ministry of Health. And I'm doing this on behalf of Dr. Hafiz Adam, the Director for Technical Coordination, who would have wished to stay to give the closing remarks, but had to leave to attend to other equally important assignments. So I wouldn't want to belabor the point because a lot has been said since morning, but I want to re-emphasize that as from us at the Ministry of Health, we place a very important emphasis on intersectoral collaboration. We think that the Ministry of Health cannot do it all alone, and that we need the support of other sectors to work together to improve the health and well-being of the people of Ghana. We think that beyond the traditional health sector, there are other key determinants that affect population health and well-being. We can talk about factors such as educational status. We can talk about the built environment, where we live, we school, and where we are born. We can also talk about the economy. We can talk about even our social systems. All of that have serious impact on population health. And as Ministry of Health, we cannot sit and watch people get sick and get to us for us to treat them. But then working closely with other sectors whose purview falls, or who have control over this determinant of health, we think that we can do better than sitting at our hospitals and waiting for our population to get sick and come to us. We think that intersectoral collaboration also promotes the use of resources in an era where resources are very scarce. We think that when we work closely with other sectors, we can efficiently use these resources to collectively improve population health, especially our colleagues from other ministries or our colleagues' ministries. Our mandate has by default has designed us to work in silos. But then at the end, whatever we are doing is to ensure that our population are secured. And so the point here is that it is very important that whilst there is the need to move away from working in silos and consider working together so that collectively we can address the health needs of the people. The health that affect the people that are sick and comes to the health sector are either me or you sitting here, or people that we are related to. And so we have the opportunity as leaders from various sectors for us to consider working together so that we can improve the health and well-being of the people of Ghana. As it's been said already, as we live here, let us not forget the topic or all the things that we discuss here, but then let us continue to come to a realization that there is we can do much more better if we work together. Let us continue to work within the framework of whole of government and whole of society approach. And I think that at the end of the day, the population of Ghana will benefit or will be the most beneficiary. I thank you for your attention.
Thank you very much. Let me do this short acknowledgement and then we'll take our closing prayer. Thank you so much, Business and Financial Times, GBC, Atinka, and GNA. We are also much grateful for MOH, NCD Alliance Global, and NCD Alliance Ghana, Luna MN, Harry B, Hemsley Charitable Trust. Thank you all so much. Don't forget, today is World Obesity Day. If we could stand up so that we take the closing prayer, if you don't mind. Shall we be upstanding? Our gracious and eternal God, we thank you so much for today. We bless your holy name. As we began with you, you have steered our affairs of our meeting successfully. We thank you for the plans we have on paper. We pray for strength, that you continue to bind us together with a rope of love, unity, and understanding. Endue us with that spirit of wisdom, knowledge. We thank you that you give us boldness, even as advocates. We pray for such a collaborative, and fruitful engagement to continue from grace to grace. We bless you that you provide the resources that we need to champion this cause and campaign forward. We give you praise, we give you glory, even as we depart this place. We speak and declare safety to and fro. Cause everyone to get to their destination safely. And in the end, we shall be careful to give you back the praise and glory. In Jesus' name we have prayed. Amen. Thank you all so much for coming. We hope to see you in our next meeting. Thank you. Don't forget to network, take contacts, very important.